drinking noise.
All right, commissioners meeting agenda, and we're starting off Wednesday, January 3rd, 2024. All commissioners are present. And first item on the agenda is public comment. Seeing none at this time, I'm going to move on to elected officials.
Well, and why don't we just say, as long as this is our first live television like this, that we've never restrained public comment. Anybody shows up, we invite them into the meeting and they can say whatever they want.
A few weeks ago.
Normal conversation.
A few weeks ago, we had two individuals that attended. We asked if they want, and we always have public comment at the beginning of our meetings. And after that, during that meeting, as it was coming to a conclusion, as we're about to go into a non-public, we asked if they had any if they had any comments after listening to the meeting, and they had none, and they appreciated us asking both times.
Yeah, the other thing, since the Sentinel asked, I think our minutes are long. I think they're very complete, and I think we've relied on them a lot in the past to just go back and see what we did and why we did it.
Yeah.
And it's maybe important to just remind people that there's no statutory requirement that minutes get posted other than being available for the public. So there's nothing, there's no requirement to upload things and the website is cute, it's popular. But we've always complied with the law.
Yeah.
And I know that there was that city councilor that seemed to think that we lack transparency in the minutes, but it's never even been to a meeting. So I don't know how he could tell the difference between what happened at the meeting and what he saw in the minutes.
Yeah.
So, I can't be bothered with it. I mean,
Well,
I
that's
think
how I
we
had it anyway. You just want to beat us up.
I think we've had more public debate and public comment and more openness than any other public body in the area.
Well, I was gonna discuss this later on, but since you brought it up, I think it goes beyond this meeting. It goes that we've been willing to answer any question at any time before anyone.
Right.
Whether it's Dan Mitchell,
Yeah.
whether it's the Keene Sentinel, whether it's a right to know, whether it was a town that asked us to come out to talk about anything, a group. I'm going next week to the Swansea Economic Development Committee and speaking
Oh,
with
are
them. You wanna come, you can come on Tuesday, you're more than welcome.
I was on the list last time. And
Yeah.
You forced me to a different event.
Yeah, no, I didn't, Dan did.
Oh, right.
But if you would like to go, it's 5 o'clock. It's at Wickham Hall on Tuesday. And,
That might be.
you're in Canaan, that's what I thought, so. But we do this on a regular basis, whether it's Lions Club I've talked to, Rotary I've talked to, you name it, we've done Zoom with towns around issues that are important. We've sent out letters updating towns about what we're doing, not just towns that we're contracting around EMS services, but all towns of what we're doing. And we send out an annual report.
And the other thing I'll say is, I think that without exception, we are more transparent and quicker to release any and all documents that have ever been asked of us without any resistance whatsoever. Never any resistance.
Well, we actually,
Unlike many other communities in the area. So, I mean, you look at the EMS thing, we have produced thousands of documents for everybody and their brother about every step, every action.
I had a reporter from the Sentinel actually say, this is amazing. You mean you can send it to me right in like 5 minutes? I said, you're asking for one document that I have in my hand. I have to walk across the hall to put it in, but I can, and scan it so that I can send it to you. But yes, I can. This is amazing. Said, all I needed is the right to know request. And once you got that.
And
So-
historically, we haven't actually required that it be in writing. I mean, if somebody shows up and they say, hey, I'd like this, we simply give it. We don't stand on ceremony and force you to do certain things.
Yeah, the right to
Sometimes
know,
helpful.
the right to know thing is, in my mind, was only written for controversial things and for things that had propriety of some sort, you had to have time and edit it
Mhm.
and things like that, but just normal documents.
Yeah.
Just release it.
Right.
That's the point. What's the
Exactly.
big deal?
Right. So, all right, I'm gonna move on.
Anyway, so you can reply back and have her, you can have her.
Well, I'm gonna bring some of the other things up later on. So, we've already said public comment, elected officials and department head, updates. Doug, anything aside from, in any, issues outside of any non-publics or,
Just briefly, yeah, we have, strangely enough, one inmate positive COVID in general population. We had six, it's going around. We had 6 staff with positive cases in the last 2 weeks. Had one inmate, first time ever that an inmate in general population didn't lead us to testing others on the same unit and finding other cases. It was just the one, and knock on wood, hopefully it won't.
Right.
But that's enough to trigger the quarantine process and COVID unit and all that. So we're experiencing that at
Is
this
the number of
point.
days you have to quarantine changed?
It's nothing's changed around standards from CDC for us in terms of how we deal with it with the inmate population. Currently for staff, we're on a 5-day out of work, 5 full days out of work. If within 24 hours of return you have no or nil symptoms, you can return to work with an what's the special mask called?
95.
Yeah, an N95 mask for a week. So that's a little bit shorter. And our initial quarantine, which was as high for inmates coming in, was as high as 14 days at the peak. That's back down to 10 days. So there's a couple changes from the peak of COVID, and I wish there would be more, honestly, but not to go off on a political soapbox, but love to see this really treated like the flu is, especially where we have Paxlovid available now. If an inmates who are more vulnerable generally and who could get more sick, but we have Paxlovid now, but we really have to follow both CDC and state of New Hampshire guidance. And other than a couple minor places that's lessened, it's not that different.
Do you have a sense of the immunization status of the inmates? COVID vaccine?
I don't anymore, really. We were tracking that somewhat again a couple of years ago. I have a sense of it. It's low, far lower than the general population. But I think the general population's also far lower than it was at the peak. As people have had either vaccines or had COVID once, twice, sometimes 3 times, and there's a general level of immunity out there that's different between vaccines and natural immunity. But I don't have numbers.
Okay.
Doug, what
The
happens
inmate-
if, what
ahead.
happens if the quarantine is sort of like in the middle of their release time? You know, say I'm, supposed to be released Tuesday, but then I get COVID.
You mean release back to the community?
Yeah.
Yeah.
Well,
They get released.
they have to.
The only difference would be if they were released where the requirement was to be in a treatment program, which does happen. We would need to notify that treatment program, and depending on their policy, it could delay the intake. But that's a small percentage of releases overall.
Yeah, the law says when you're done, so. Yeah.
okay, anything else, Doug?
Yeah, just Yeah, just our freezer, walk-in freezers on the fritz, and we had to bring in an urgent way a transportable trailer freezer. Looking to get the part, unexpected expense. It's 2,500 just to keep the food from going bad and bringing in this transportable freezer. So just an unexpected, somewhat significant expense. And that doesn't yet include the cost to repair the freezer, but
What's the problem?
we're not a new facility anymore. Things are, as I've talked about, breaking with greater frequency. It is what it is.
Okay.
Nothing
Okay.
else, other
So,
than
well, the
the,
staffing,
what's that?
staffing,
Staff. Yeah, I'll say this, the officers are certainly very positive and grateful about the projected potential pay increases, understanding that we're still going through the county government process and nothing's official till April. But I do believe that it will help retention first. We'll see it there. The people that might have been thinking about leaving, it's not an insignificant bump. And for some, I think that will keep them here. And then once we can be more public about it, I hope we can recruit and, put something, as Chris and I were talking about, into our advertising that may attract people for the increased pay rate that we anticipate having. And so we've had, whether it's, we've had no new resignations since that information became public. We have had 4 or 5 hires, staff hires, but I can't say that the reason we got them was the pay increase. They were in process, various stages of process here, but one of them, a word of mouth referral from another officer, very well could have been because they would have been taking a pay cut. She was interviewed this past week, though, and is coming on. And I think the potential bump in pay, again, it's delicate conversation. Can't promise where we'll be, but that might have impacted one of 5 new hires. And so on paper, if no one else leaves and everyone who's slated to start comes in, we will be within 2 of full staffing by mid-January. Knock on wood.
Nice.
Yes.
and I've said all along that, I mean, when you look at other counties and some of the struggles they're having, Rockingham's a prime example where, last I knew, at their peak, they're like almost 50 down, and now they've whittled it down, but they still have close to 20 that they're still down. We're doing some good stuff here.
Well, I think a lot of it always the atmosphere, the standards, and the operation of the facility. I think
And the facility itself, yeah.
I think we've always been better staffed than virtually every other jail in the state.
I don't disagree.
We pay more than any other jail in the county.
That is a fact. That is,
I'm gonna keep on moving on. Kim, do you have anything for us today, or are
Okay.
you just listening in
Could
for
you-
your input if needed?
Chris, sorry. Could you text me when you want to talk about the body scanner item?
Your body scanner is actually the first item after we get done, so it's gonna be pretty quick.
All right, I'll just wait. Yeah, I'll hang in here.
All right, Sheriff, do you have anything aside from why you're here?
I think we can, I just briefly talked to Cheryl, I think we can talk to that in regular conversation
Yeah.
without names, so I can
Yeah,
probably follow up basically on what Doug was saying related to COVID. The county kind of is following the guidance that we get from the CDC on when it comes to COVID. And, for some folks that works because they can take time off, you know, I myself had it and I took time off. Others, yeah. Others, you know, have the time, but from time to time, we might have, someone who is brand new to the organization, still within that 3-month period where they do accumulate sick time, but they can't use it. And, unfortunately, that did happen in my department where, someone, was, positive for COVID and he was just within a couple of weeks from his 3 months. And he was not able to use their sick time. So I'm asking that at least knowing that we're still dealing with this COVID and still trying to understand it. And because we are following a guidance that basically tells you can't work if you're infected, if you have COVID, that we at least wait, that 3-month, wait, to be able to use, your sick time if you do have COVID in that period. And we would like that to be retroactive, you know, to allow for, I think this person within my department that was within just outside of the 3-month window to, use, earned time.
These would be for illnesses that,
Well, I think we're kind of, right now, we're kind of, because we are following the CDC guidance that this is what we have to do and we're still learning about it and we're still dealing with different variants, so there is no kind of, you know, we don't know what COVID is gonna take us, you know, in the long run because of all the different variants that we get. Sometimes we think we have it under control and new variants comes out and we gotta get vaccinated or not gonna get vaccinated. So I think because of the county basically following the guidance that you will have to be off. And that's regardless of whether you have sick time or not, or you have earned time, or you're new to the agency. So this individual had to go without pay because he had not met that window that we have to as a brand
How long ago was this here?
new, recently, yeah.
Can I ask a
Like, within the last
question,
pay-
regardless of whether you have time or not?
No, what they,
Yeah.
to use their sick time, regardless whether they met the 3-month window to wait to use it. So they're earning the time, but they can't use it.
So the policy is you begin to accrue time and you have to go through a bit of a probationary period before you can
So-
access it.
Yeah, so prior to the last contract,
9 months to 6 months.
all employees could not access sick or vacation time for the first 6 months.
Right.
We've now decreased that to 90 days. So now
93.
people have the ability to access sick and vacation
Okay.
time after 90 days. It doesn't accrue a lot, so it's not gonna change the fact that if you end up using the time, that you might not get sick a week later with something completely different, or even when at your 3-month mark and you don't have any time available. But, and I'm not saying that this isn't a good conversation to have, because I think it is a good conversation to have. We'd have to consider the impact on the entire county, because
Yeah,
it's not just
Yeah,
Eli's, and further, the nursing home, they have a lot of things
right.
that you can't go to work if you
Right.
have symptoms, not just, not
Right.
just COVID.
It doesn't bother me to maintain the policy of a 90-day wait. That, in my view, would yield an exception for federal policy or state policy, particularly on public health issues, right? Because I think that would be inconsistent if we're interested in following the guidance of state, federal officials on public health issues. It would be silly to enforce a policy that runs counter to a higher level of government, you know what I mean?
So a couple things though, and I'm not trying to say that
Yeah,
that's not,
guidance.
it's gonna have to be something that I'm not sure how that will be managed.
Yeah, I know.
I honestly, as far
Well,
as it being understood when it's okay to utilize, I mean, COVID is obviously easy
Right,
to recognize that somebody has COVID or say that somebody has COVID. But at the nursing home, you just call and say, I've got diarrhea, you're out for the next 24 hours.
right.
And it's like, and it's, it may need to start small, and then, but secondly, CDC has guidelines for flu that we don't follow.
Right.
So it's like,
Well, look, how about we look at the bigger picture of what the, in 90 days is intended to control or prevent or regulate, and it seems as though it would be the abuse of sick time the moment you get into a new job, so if we believe that is a high likelihood, right, then the policy.
Let's look at the reason that we have that policy.
Yes,
Yes, that 90 days, does it financially affect our, the stability of the plan?
well, I mean, there's certainly the financial impact that when there's always a financial impact of when people take holiday time off, especially in all these 24/7 operations, because when somebody calls out sick, you have to fill their position. And I mean, there are some areas that can go short, but you're paying them to be out plus somebody else to come in and do their job. So I mean, but once you hit the 90-day mark, there's so many people that have access to leave time. I'm not saying that this is necessarily a bad thing to do. I think going down the road of allowing every single potential thing that
Right.
we say you can't come in.
I see.
I mean, starting with COVID might be a manageable situation.
Well, at any given time, how many people do we have on that probationary period?
A lot, because we
Is
have
it?
so much turnover.
Well, it's a probationary, you've hit it on the head. The commissioners in the past have always wanted to have a probationary period for somebody coming on. And part of that was the medical plan. The medical plan financially is already in place cost-wise, correct me if I'm
Say that
wrong.
again,
The medical plan is in place,
after 60 days.
no, but it's how would you describe the medical plan? Like, it's not an effect to us per se in that position. Is that planned for or not?
It's not.
If we have an employee that's coming on in a position and they have that FTE in the budget, is that medical plan also in the plan?
Not exactly. I mean, we base it based on kind of history and recognizing when we're ramping up departments, that we have on average a certain number of covered lives. We don't have a policy, and I know some, well, I don't think so anymore under ACA, but, there used to be some companies that only had so many benefited FTEs, and you had to wait for somebody to leave before you could hop on. If you meet the requirements that you work 30 or more hours per week,
You're on,
you have the ability to join our plan.
yeah.
And it's always been like that. We've never, held a certain number of positions.
Well, all I'm asking is that that we have to send them home. We don't care. I'm sorry, you have to go home because that's what the county has adopted the CDC policy. I'm only 2 weeks away or 3 weeks away, whatever, I have the time accumulated. Can I use it? It's not that they don't have the time, if they don't have the time, then they're gonna go without pay, but they're already earning the time. They just have to wait a window. So we can say, hey, that will be up to your department head to authorize it. Whether you can use your time, that could be some way to balance it. The other thing is that we do have some mechanism in place to control abuse of sick time, We can ask them to produce a doctor's note that they're out for more than 3 days. Or at 6 months, if they're taking so many sick days in a 6-month period, we can ask them that anytime you take a sick day, regardless of what it is, you have to have a doctor's note. That controls that potential abuse guy that takes a sick day every month. Well, hey, you've taken 6 sick days in 3 months. Anytime you call out, I want a doctor's note, that helps kind of control that potential abuse. So there's some mechanism in place if we fear that. But I think we do offer insurance to start at 60 days. This is kind of a unique situation that we are with COVID, like Doug has to make, I don't know how many staff out because of it. And they've been there quite a bit, you know, so they use their sick time. I think I have,
How close was it?
I think it was 2 weeks, 3 weeks, not even.
So are we looking to make an exception for this particular person in this particular instance at the moment? Or are we looking to,
Well, I was
make
gonna.
the, exception for COVID positive new employees?
I was gonna approach it as for individually, but I think in talking with Cheryl, I think we might need to talk about more generic, whether, hey, okay, upon, you know, if your department head approves it, then we can waive it and gotta have that permission from the commissioner to waive that 90-day period, because it could be a legitimate sick time, and if you have,
What if they're within a month?
It's a,
Yeah, I mean,
Well, you're either in.
it's easy,
I mean, you either hit the line or there is no line.
and you may not even have, I mean, if you're full-time, you're earning just over 3 hours every 2 weeks. So
Right.
it's possible that a brand spanking new person's not gonna even, I mean, they might have 3 hours to use. I would recommend that if we go in the direction that we're going to allow for the use of sick time in cases of COVID prior to the 90-day probationary period, that it be countywide. I also.
I agree.
My other suggestion would be that, recognizing you don't have to go to the doctors anymore or the hospital to get a COVID test, but obviously you tested positive somehow.
Right.
I know anybody can do anything to give, information that's not true, but I think that the employee also needs to send in a copy of their positive test.
Yeah, they can take a photo of it.
And I've had it in my office. I know somebody said, well, you can get those right on the internet. Well, if anybody really wants to go that deep, but,
Yeah, I'm just not prepared to distrust new employees all that.
Yeah.
Same here.
so and one of the reasons we had that situation with the DOC where one of the supervisors asked one of the correctional officers of many, there was a handful of correctional officers that came down with COVID for a copy of his test because it probably seemed like an appropriate thing to do. And even though the correctional officer did it, he did give the supervisor gave feedback that, why am I being asked to do this? Well, I think we should require that countywide. I know the nursing home requires it. I know I require it. I did suggest that to Doug that he puts it into place just so that it doesn't feel like anybody's being singled out.
Right.
How can we, I'm sorry.
We
how
now
can-
require it, Cheryl. I did make a directive about that officially.
Provide medical, and
How
you're
can-
saying you're
All
saying,
right,
are you
wait, I can
providing?
hear what
How
Doug
can
said.
you?
so when we have Doug go first and then you come in second. So Doug, say what you just said again.
I'm just confirming that based on that case and situation you just spoke about, I took your suggestion to be consistent and it seems reasonable. And so I've put out a directive. It's now DOC policy, if you will, that staff will take a photo of a positive test and text it in if it's a COVID sick call.
So I'm sorry, what did you say?
I'm just don't know whether it's something maybe Kim can answer. Can we even ask someone to produce documentation of the medical condition?
Sure.
We do
I'm
not-
testing.
We asked him.
Well,
Yeah,
No.
Doctors know.
Well,
Yeah.
but doctors know, typically will say that they can go back to work, but they don't tell you what the condition was.
But they're already telling you that they.
Can we just, Kim?
Yeah.
Yeah.
Oh,
Yeah, what?
I'm here.
Yes, Lisa.
Yes,
Oh,
we
no,
can.
she's saying yes, I'm
We-
here.
We can ask for a picture of a positive COVID result because we're not asking for specifics, but we have to be careful.
But aren't we already making the determination when they call in and tell us that they have COVID, that they have to be out for
Right.
5 days?
Yeah, they've
And because if
self-identified.
they just said, I'm not feeling well, then you're not making the determination that they can't come back to work the next day.
So the typical guidelines, I always have followed the CDC recommendations. The typical guidelines are if you call in and say, I throwing up or I have diarrhea. Well, you can't come in for 24 hours after your last episode. That's just kind of recommendation, common sense. if they call in and say, I'm not feeling well, I feel like I have a cold, I would ask them, have you taken a COVID test? Simply because of what we've just lived through for the past 3 years. But it's no different than the flu, I don't think. One of the things that I'm wondering is so right now, so Maplewood has its own, because of CMS, Maplewood has to follow a whole separate policy. I think with Doug, it's different because he has the inmate population and confined quarters that we can't necessarily change. And with EMS, obviously, it's a medical population. For the Keene campus, Keene, 33 West, and even Connected Families, there's nothing that says we have to follow the CDC recommendations. We can tell people they have to wear KN95 until they're symptom-free. We can come up with what we want to do on our campuses, but it has to be consistent, not just one department or another department.
So in other words, you're saying we could come up with a protocol that even if you could test positive COVID, that if you are feeling okay, as long as you're protecting yourself, you could come back to work within 24 hours or whenever you're ready to. Is that what you're indicating? Rather than waiting now currently the 5 days that we're requiring people?
I'm saying that we don't have to follow the CDC recommendations. We can come up with our own protocol. But what we've been doing outside of the DOC, EMS, and Maplewood is following the CDC recommendations. But that's exactly what they are recommendations. They're not mandates. They're not.
All right, so if I just come back, just to keep this moving along. If we're all comfortable with making an exception for the use of sick time for a probationary period for COVID confirmed illness, then you guys just want to work out the details of how that gets applied in the various departments.
I think we can.
Does that provide enough clarity for?
As long as they have the earned time.
Yeah, and they have to have.
Yeah, you can't take it if you
You
haven't.
can't take
Yeah.
it, well, you can take it, but not get paid for it.
Yeah, no.
Yeah, but I mean, if you've earned time when they take it, really doesn't affect the stability of our health plan, does it?
Has
No.
nothing to do with our health plan.
Well,
Yeah.
yeah, so then why wouldn't?
So, yeah,
I mean,
and then.
all of these policies are based on.
And it begs the question of why we even have.
Well, that's why I brought this back. I mean, in a way, I think there's a historical bias to not trust employees that are new, and they're gonna come in and surely there's been examples. Somebody comes in, Amazon gives you health benefits from day one these days. We've always said, gee, if you get health insurance from day one and you're pregnant, now I'm in for $1, and then after they have the baby, they quit. So meanwhile, we've paid for the whole deal. You know, from a social policy point of view, that's expensive, but maybe it's not such a bad policy. But I don't know the frequency that people get a job simply to take advantage of healthcare because they know they're sick. But that, I think, is why that guardrail is up. I mean, historically.
Yeah. Well, we also, I mean, some of it, I mean, and then also everybody prepays a month in advance, so.
Right.
There's, I mean, we'd have to change that whole thing.
Right,
If we
right,
have
right.
any inclination of going from day one, that now everybody else needs to get a 1 month reprieve.
Right.
But anyway, that's.
All right, so
I know.
are we fine with this limited modification?
Yeah, and I
Existing
also,
policy.
just as a manageable point, not that you really all care, this will have to be managed by each of the departments so that it's known when they add sick time, that they're identifying right from the very beginning. And I'll let everybody know that it's because of a COVID positive. That way, we're not questioning why somebody.
Right.
We'll have a whole reconciliation process at the end. So.
Okay, any other questions?
So,
Vote? No.
So I need
Aye.
We need a motion of what you had said.
All right.
You record it now.
So the motion is to modify the existing sick leave policy to allow for COVID-related illnesses to access accrued time prior to the 90-day typical period.
Okay,
That's
So-
it.
is there a motion?
Second.
Yes.
Okay, and so Commissioner Wasmac, aye. Commissioner England, Commissioner Clark, yes. You got the motion. All right, we're good to go.
Okay.
Well, depending on where we're at.
So that was elected officials, and department head updates. I'm moving on to scheduled items. Master agenda item 1147. A text 84 body scanner request by DOC. Doug is here. Our superintendent to action expected to discuss, improve, or deny the purchase of new body scanners for the DOC, as well as potential bid waiver pending reception of opiate abatement funding. Doug, in your packets, I believe you received a document. It's actually in the packet before you too. It's right here. This is what it looks like. And Doug's gonna talk to it. Doug?
Okay, yes, so when we were at the conference, several of us looked at a body scanner from Tech 84, and we've had some interest in this for a couple of years. The opioid abatement funds give us more opportunity to maybe move forward on this. Contraband drug introduction remains a significant issue, escalating issue, if anything. We do a good job with our search process and other ways of managing it. But for example, the facility did, we are fairly sure, have some fentanyl that got in here a couple months back, a significant quantity. The body scanner technology is improving. This is a sole source document from this company. I'll let you look at it. There are a few aspects of it that really do appeal to me. And I have tried to research to verify whether there's another product out there that's similar. The things that they're verifying in this sole source document that are unique to the Tech 84 product is that it is the only scanner where the X-ray beam images from feet to head and in a horizontal fashion. So it's the scanning ray is moving up and down, as opposed to a number of other products where the scan is in a fixed location, usually down near the feet level, pointing up. And the degree of distortion that happens when you're scanning at an angle as compared to horizontally, it's very noticeable. We saw some demos, and that's a feature that is mentioned that's of importance to us. The other one is the footprint of it. As far as I can tell and what I've found, it is the smallest footprint in the location where we want to put it, along with the fact that it is mobile. It's not fixed into the floor in a permanent fashion, is very appealing in terms of our space and where we would use it in the booking department. And lastly, being able to select the dose range so that you can ensure safety but have multiple potential uses over the course of a year is a unique feature that has some real appeal. The cost of it would be $142,000. That includes a 2-year warranty and maintenance contract. After that, there are some potential maintenance costs after that 2 years. It does have moving parts, and we would anticipate having a pretty frequent use of it. We would have to develop policies that support it and all, but we would anticipate scanning all our bookings other than probably protective custody folks who stay so briefly and don't ever run the risk of moving into general population. We would also use it when we have suspicion or intelligence that there's drug use happening in the facility. But the real question before you is, because it would be, even though it's passed through from the grant, it is a sole source request, an exception to going to competitive bid, where I truly don't know how I would go to competitive bid from what I've been able to research.
Well, there are other body scanners out there. So I'm presuming this is something like what you get when you aboard an American airline plane, maybe not Spirit, because they probably just use flashlights, but is that, so what is it intended to exceed? I guess. What are we looking, what's the problem we're fixing with this?
It's fine, but it can't be.
What's the problem we're fixing?
Yeah, I don't know I mean, is this gonna hide, if I have some heroin in a condom in my rectum, I mean, what is this intended to see?
It's gonna see that you have something in your rectum, and it's going to cause us, based on training and seeing that there is something that shouldn't be there, to, unless you acknowledge it and remove it for us, then you're going to be held in segregation longer, potentially dry celled. And until you both pass a drug test and a repeat scan where that item is no longer showing up on a comparison scan, you're not going to bring that heroin, or more likely fentanyl nowadays, into general population.
Hey,
And-
just so you guys know, this is Allison. Sadly, I can readily admit there were at least 2 people that have been in my program that have smuggled drugs in, and they're not always found right away. And they were found. I mean, some of them are not the cleverest, but we have a lot of people introducing. And I, along with Doug, I was at the conference and met with the scanner, and I was incredibly impressed. And I do realize it's expensive, but I think it's a necessary evil, unfortunately, because we do have a lot of people smuggling stuff in. And I think, fortunately, for Doug and his predecessor, Rick, we don't have as many drugs in our prison, jail, etc., as like compared to the state prison, but still it's an issue. And we have people who have been incarcerated who, like a couple of months out, are all of a sudden testing positive for Suboxone, and they're not prescribed. So I do think it would really be a necessary thing. Sorry, Doug, I'm just one of my 2 cents in there.
And so what, do you have a sense of the frequency that drugs find their way in undetected through our existing process?
Probably based on finding drugs that we believe were introduced from outside to differentiate from diversion of Suboxone from the
Right.
prescribed process.
Right,
That's an important distinction.
yeah,
Probably 3 to 5 times a year that we find it, catch it, and have good evidence. How many times is it happening beyond that we catch it? It's safe to say it's more than that. But I don't know. But
and
it's very hard.
So the amount of radiation to penetrate to see your colon, for example, I don't know how to gauge that. Do you, Doctor?
I do not.
I do. Well, I
Tell me
mean, I have a report. They have what's called an ANSI standard, American National Standard Institute.
Yeah,
And we all have radiation exposure every day to some extent, just naturally. But
I wear a
to
tin hat.
cut to the chase, a couple things. This is a higher level of radiation than an airport scanner, which is designed to detect items in your clothing, not penetrate past the skin.
Right.
This is a higher level at the maximum dose, okay, and you can change the dose levels. This would allow 30 scans per year. The higher the dose, the more accurate the resolution. There are 7 different dose levels. You can set this to do a placebo. It's probably not the word. You can set it and do it, and the inmate wouldn't know there's no radiation. But at the lowest level, it's probably several hundred times a year per person that is safe based on the research and the documentation they provided.
Is this for everybody coming through the door, and would there be a risk to operator?
No, and also that their scanner is unique in terms of the sort of safety zone. Other scanners, in the way they're designed, the officer has to stand further away from the scanner. This scanner, the radiation range is really confined to the perimeter of the internal scanner itself. And we expect would be a significant deterrent effect pretty quickly with this thing.
What if somebody objects on the basis that they're a career criminal, a frequent flyer, and they've come to our jail 12 times a year, and we're going to expose them to full body penetrating radiation repeatedly?
We
have liability for causing cancer.
They would be SOL. We would have documentation of the dosing and the research, and it tracks per inmate. It tracks a history. So when you plug in the inmate number, you see their entire history of scans and dose level, including the cumulative current dose for the year that you're in, and the scan history based on number of scans, prior dose, and the current, I forget what they call it, ANSI, however you measure radiation exposure, it tracks it and documents it as an individual case record.
What about work release? I don't know that we have.
0.25 USVs, I don't know what those are. But the standard is as low as reasonably achievable, which is, sounds like a joke, but. What's the what?
Would work release have to get them daily? I mean, I don't think we have many work release as often as before, but would they have to get one every time they left and came back?
Work release is a good example of a person that would have the most frequent and cumulative number of scans. We would probably and almost certainly not scan them at the highest doses, and on occasion they would get random scans without knowing when they would be scanned. It wouldn't be every day. Some percentage of the scans that they would not know would appear that they were scanned, but the dose would be 0. They'd actually not be getting a dose. And you can adjust to lower levels so that even in a work release case, it's really hard to imagine coming even close to, say, 50% of the allowable safe limits. But it is actually the best example, potentially most frequent use.
How much preparation for the person being checked has to be done? Presumably removing everything from pockets and taking off their belt, perhaps similar to an airline screening?
Yeah, they would already have been through our standard PAT search. Not sure, possibly even for new bookings who have to do a strip search, we'd probably have done that already. Then put them into their jail garb where there's nothing but the clothing itself. And then put them in the scanner, and it takes 4 seconds of scanning time and probably a 5 to 10 minute process per inmate from start
Does
to
this-
finish.
Does this remove or eliminate the need for the strip search process?
I don't know. I would want to research best practices, other policies, which I have or will have access to if we go down this path. The rep has said he can send us sample policies. I don't know what would be considered best practice. It may be completely unnecessary to do a strip search if you're using this. I could see where that could be the case.
Well, if this
And-
machine operates the way you described it, then you wouldn't need a strip search. Because
That's
it
my
is
thinking. I mean, I think, you know, the energy around strip search tends to be, it's a rather invasive and humiliating experience, I would imagine. I don't know, you know, can we, get a little more information somehow? I mean, I get it. I'm just not sure. I'm just nervous about the radiation.
Yeah, I can send you the whole packet of information, including the research on the ANSI standards, the radiation safety aspect of this. Yeah.
So
I can
do
get
any other counties within the state have it, or from other jails? What's their experience? Do you know that?
No, none in New Hampshire. There are definitely other jails and prisons using the product. I have not done a reference check, so to speak, but would plan to do that. And part of my bringing it forward now is anticipating the February 5th review of the budget by executive committee and the potential to bring this through that process. It may not be, maybe I'm not accurate that because it's grant money, I don't know that we couldn't do it after that date. If the
Well, I think you still
process,
have to gross budget it. don't
We
you?
still need the appropriation.
Yeah, you
Yeah.
still need to gross budget it.
Yeah.
okay,
You
yeah,
know,
that was, okay, so that was my interest in bringing it forward now and trying
I-
to get a
When do you meet
decision
with the executive committee?
February.
You meet with- Yeah, so,
Oh, we got time.
yeah.
yeah. 'cause
But
that's
I
what we
also
wanna-
think that, I mean, I've heard other counties are looking at something like this, or whether it's this or something else. Especially what happened, I mean, Jason Henry has talked about, you know, this, or something like this. Because of the incident that occurred over there where they had the individual that was packing, they were in holding, they weren't even in the correction facility, able to pull it out, it exploded. They had to Narcan 4 COs and the individual. Got on the clothing, to the sheriffs were going to bring the clothing in, they collapsed, they needed to be Narcan. So there is, it is real, and so I'm wondering if
Yeah.
others are looking at this too.
It is real, and it is, unless we're just getting better and better at our efforts to detect it, and we are taking it more and more seriously because we see this happening. And not to pick on drug court, but there are certain percentage of inmates that know they're coming to jail. We had an individual who we absolutely believe he intentionally got reincarcerated. This is the guy with the fentanyl. Because the opportunity to sell the fentanyl in jail, it's more profitable. And that sounds crazy. But also, Jack, to your point about how often, 3 to 5 times, I'm saying we detect actual drugs and we can get a guilty finding on an internal review, or we send it out to outside law enforcement when we have a certain standard of evidence. But it's probably 20 to 25 times a year that we're suspecting, and we're seeing on camera individuals rooting around in their anal cavity, or appearing to, under a blanket, or reaching down between their legs while they're sitting on the toilet. And we attempt to intervene, but we can't always catch him and find the actual drugs. So I want to clarify that when I said 3 to 5, that's like tangible, something came in from outside and we had certainty.
Well, we also know at the courthouse the other day, the new courthouse, you had an individual that found out he was going back to the corrections facility, and all of a sudden started just doing the drugs smack dab right there on the table, as much drugs as he possibly could get into him before he went back, to the point where we had to call Keene Fire Department to come over because of the issues he was having, because he was taking all these drugs in. It also affected one of our sheriff's people that we had to, go to the hospital, then send home after he was okayed by the hospital. I mean, it's everywhere.
Well,
And this at least, once we get we received what, 1.4 million, Doug, from the opiate trust fund when we applied for the grant. We've utilized some of that money this year. We could utilize again that, whatever the amount, once you feel satisfied that it's a safe product. And
what's the availability of the opioid funds and
well, here's the thing, we've been promised the money. We have not received the money, and that's why we said pending receiving of the funding.
Yeah.
Because we have been notified by the state of New Hampshire, this is what we're going to be receiving, but in the ways of the state of New Hampshire, they take their time getting us the money.
But I'm not sure if he's talking about two different things, because we have the opiate trust funds that we have, which, what do we have, a couple $100,000, I can look up that specifically. But
Yeah,
we're
we used 100,000 this year.
well, we ended up using 76,000 because there were a couple things, Allison's program, so we used 76,000 of those.
Okay,
But I don't know, are you aware we're getting over $1 million?
yeah, 1.4 million.
From a grant that, it's
the opiate settlement?
it's
Yeah.
really reimbursement from previous expenses, but it's.
Yeah.
That's.
All right.
It's it's separate. Yeah, that's the portion of the funds that I'd be looking, not the standard, what is it, 15% that,
15% that we received, yeah. Because we're
yeah. And Jack, I don't know if you're asking, it's not certain, but it is generally expected that the fund will continue to receive money, and they will open it up for future grants in future years. And I'm not saying every year, maybe only every several, but there is the potential that this opioid abatement fund is usable for, the projection I've heard is at least 10 years into the future. But We used 294,000 of it, I think, in bridging around the staffing increase recently. This is 142,000 of a 1.4 million grant.
What is the, what does the thermal scanner do or show?
That's an add-on for about 20,000 that, to be honest, from what I can tell, they started adding that into this equipment, which is clearly meant to be a full body X-ray scanner as its intended purpose. But it came at the time of COVID, in part because it allowed other facilities to use COVID-related funding to get this product, grant funding. And I believe it was kind of created because I'm not asking to use that. We could scan.
Here is you check somebody's temperature, see if they have a fever?
Yeah, it's literally, while they're in the scanner, it also does the same thing, maybe more accurately. For 20,000, I sure hope so, but we believe a handheld temperature scanner that we have used at the height of COVID to check people into the facility that might cost a few thousand at most is completely suitable for that. But that's what that's referring to. It's an add-on or an optional component of the system for COVID-related thermal temperature screening.
What's the price of this device?
142,000.
That's with the thermal thing too, or?
No, it doesn't.
No,
Without?
without.
That'd be $20,000 add-on. So you're looking for more information?
Well, I would appreciate it. I mean, I'm just, I'm almost also inclined to see if Primex has any experience with it or has any research on the liability associated with radiation exposure.
We can ask that question. If you give them the information, I can ask that question.
All right, I'll send out.
It's a litigious group.
Right.
It's a litigious group, so I can just imagine that somebody said, listen, I had a problem with substance abuse and mental illness, and I was incarcerated 25 times, and now I've got colon cancer, or lung cancer.
Doug, can you also look at your counterparts across the state and see where they stand in if they're not moving that direction, why they're not moving in that direction, kind of thing?
Yeah, I can do it.
what are they looking at?
Yeah, I can do a survey. I'll
Okay.
send out the additional information. I take it you're most interested in the safety aspect of it in terms of the information, additional information you'd be looking for. Is that correct?
Right. Do you think the ACLU has any position on this?
I don't know. I don't know. They're in use in many other facilities, and I think they might, but I'm pretty convinced myself that the research they've done in terms of the exposure levels here are well and conservatively within medical limits. But I'll let you look at it. It's a pretty.
Would you want to hear from the company itself?
Well, I don't know if I don't know.
Okay.
I mean, I don't want to beat this to death, but it's new, it's different.
Yeah.
It's, there's room for controversy. I'm just trying to be.
Stop.
I just want to do enough due
Well,
diligence.
I think Primex would be able to answer that question adequately, because, well, they're gonna know our exposure when they're literally, you know.
Yeah, I'm wondering if they're gonna come back, to us, it's more of a risk of somebody taking drugs in and us not, is there a litigation there on that side? But I'll reach out.
I mean, this is a fairly invasive process, it seems to me.
Yeah.
But I don't know.
Okay.
It's new, so I just want to be sure we've looked at it,
Okay,
you know.
Yeah,
because-
I understand, you know, the idea of scanning an inmate 30 times in a year. It raises questions and
Yeah,
I get it. I'll let you look at the data, the numbers and the research. That's probably the biggest part of the packet that we have on this is that ANSI research and information. So I will
Do
send
they-
it out and you're here next week. We could revisit this if we have updates by then.
well, and if the decision takes longer than it might, I don't object to at least putting money in the budget to recognize the potential receipt of funds for some purpose.
yeah,
And
I
then,
think that's what we were talking about is
Good.
that if we're still waiting on these funds to come in, it would be contingent upon the receipt of the funds as well.
Right. do the staff have to, does it come with dosimetry reading, badges for staff to utilize it in proximity to assure them that they're not picking up any scatter? You know?
I don't think it does. I think there's testing they've done on the radius of the thing and secondary exposure, but I don't think there's, yeah. Yeah, I'll let you look at the data. I mean, obviously he's a salesperson, so, you know,
Right.
he spent a lot of time with us at the demo. Well, we didn't see a demo of that actual product, but video demo. We spent a lot of time reviewing the safety aspects because we had many of the same questions.
Yeah, no, I'm sure.
okay.
Okay.
All right, thank you, Doug.
Okay. And by the way, next week you're here, there is Leadership Monadnock happening on the same day. It's in the training room. Really doesn't affect anything. Other than my availability, I need to speak there, and if I need to talk to this next week or anything else, I'm here, but I'll just thought I'd mention that. That's an all-day event we do every year.
Right.
And you don't need to change the location of your meeting unless you want to, but
No, I think we'll, if
okay.
we won't be in the way, we can do that.
There'll be
Okay.
a lot of people arriving. That starts at 8:15 to 8:30, so there'll be a lot of folks arriving at about the same time, but it's not a problem from my perspective. I just wanted to
Okay.
mention it.
All right.
Okay.
Thank
All right,
you.
we're gonna move on to the next item, master agenda item 1148, semi-annual report, Connected Families, New Hampshire. Dennis Kelka is here. Jim Pfaff's here. Action expected to have Commissioner receive an informational as pulse report from the Director of Connected Families. I think for the records, just to remind people about what Connected Families is per se, to start off with would be a good thing.
Sure.
All right, thank you. You're on, Dennis.
I was wondering if we could stay on diarrhea for a little longer, but
Our cabbage search is, yeah, this has been an interesting morning.
Your co-host, so you can share the screen, your screen whenever you're
in,
ready.
will he have the same ability?
So it says he's on a phone, so I don't believe so. Yeah, I can't make him co-host.
Well, you're connected here, aren't you, Jim?
I'm about to.
Oh, okay.
Yeah, okay, I can hold on.
Let's see what's next.
Recording in progress.
So, thanks, everyone. I'll wait for Jim's volume.
You both have access.
Thank you. So thanks, everyone. We were here last on August 2nd. We want to, keep you up to date on where things are going, how things are going. Update on, some data with respect to how many families we're serving, those types of things. What are the challenges? What are the successes? The last bullet I share there is, that being connected to the county really does provide, it's a tremendous backbone the support we receive throughout the county is very helpful, critical, and supportive. The second slide here is just to give you the update that, so we're in the 4th year of our expansion grant. And as you can see, those 3 bullets there, the bullet 2, 3, and 4 are the goals that we're working on. The most specific one that we played a significant part in is the expansion of our wraparound moving to include the birth to 5 population. And that has now been sustained statewide within the Medicaid rules. So when we finish our grant, that population of children and families will be supported forever, I guess is one way to say it, but it's supported through that Medicaid funding. The development of the in-home supports, this is an area where it has continued to evolve for us. In-home supports, and, going back to Chris's statement of, who we are, what we're doing, we're really supporting the highest need children with significant mental health issues in our region. And to recall, our region expanded from just Cheshire County and Western Hillsborough County to be the whole part of the western third of the state, moving all the way up into Lower Grafton County, all of Sullivan County, for the wraparound work that we do, and then the TREC work that we do, and we'll touch on that in a moment, is coverage across the state. And we do that in collaboration with the other care management entity, NFI. But the development of in-home supports is critical because it's an area where when we start to work with a family, what can we do to help that family reach some sort of stabilization? They're at times in crisis, they're at the highest need, the child's really struggling, that child could be struggling at home, could be struggling in school, could be at risk of suicide, and what can we put in place? So what we've been really working on is how do we think about the training of those individuals who provide that. And we have worked in collaboration and partnership with Antioch University and Sharon Fitzgerald there, whose expertise is in in-home support. And so now we've moved into training those providers in a more family-driven approach to that. In this last year, and hopefully in a carryover year, not a carryover year, a no-cost extension year, we would look to work on sustainability of that to better support families who need that level of intervention and stabilization. Because as you, I think, can probably gain, is that the supports that are available to families in our community, Monadnock Family Services as the community mental health center is a great asset to the community, but is also struggling with staffing, as everyone is. And, the ability for us to have a family get connected to them quickly goes pretty well, but not always well. The last one is the implementation of multi-tiered systems of support for behavioral health and wellness there. That is being done. We've been working with 5 different schools or school districts. The 2 largest have done the most engagement with us, the Conval school system in Peterborough and the surrounding towns there, and the Jaffrey Ridge school system. The other 3 systems we wanted to have more involvement with, but they have struggled with leadership changes, with the demands of being high need schools. So we're going to continue to try to engage them, but we're really pushing towards those schools that are looking to sustain this MTSSB work. And that is really a prevention work within a school system to really identify how do we provide supports for children with respect to behavioral health and wellness at all levels. What do all the kids get? What do some of the kids get? What do the highest need kids get? Care management entity, that's what we became as of September of 23rd, 2020. So there are 2 care management entities in the state of New Hampshire, us being one, the other being NFI. Many of these pieces, we've received additional funding. We're really, the state of New Hampshire, the Bureau for Children's Behavioral Health is our partner there. They really have found us to be a strong partner with them to be able to get work done more quickly. Because the county has more flexibility than the state has. So we have received additional funding, which for the most part is pass-through funding to support child-parent psychotherapy. That is a evidence-based practice that is being implemented across the state of New Hampshire through Cassie Yackley and her group. It's the Center for Trauma and Responsive Practice Change. Trauma Responsive Practice Change. But the funding comes to us and then is passed on to them, and we monitor that funding through the contracts that we set up with them. New Hampshire Fast Forward, that is our wraparound practice. The TREC, the Transitional Residential Enhanced Care Coordination, that's for children who are in residential treatment, moving to residential treatment or psychiatric hospitalization, and coming back to the community. That's where we are working across the state for children. Now, we are not, we are working with NFI to determine, so when a child comes up and they're getting referred, the Bureau is looking at where we exist physically. They're not saying, okay, you take this one, it's all the way up in Berlin. They're giving that to NFI. So there is a balance around that. That is an area where it has continued to grow in terms of importance. It's an area where I have continued to work with the Bureau to say this is an area we need to have better funding of this. I think we're doing okay, but we want to better support that programming with better funding. And then the early childhood wraparound there is the birth to 5 work that we're still doing under the grant funds, but will be sustained beyond that through Medicaid funding. This care management entity structure has really been a strength for the state. They've really found it to be the most effective way to really reach this population. I think Jim may be able to touch on a little bit of this when comparing it to other evidence-based practices and how that has compared to other evidence-based practices being implemented in the state. But with respect to the state seeing us as a resource to really help solve some of these issues, most particularly or most recently, we've had high priority youth that the DCYF has identified, and these are youth who fit into that transitional residential category. So they're in some sort of residential environment. They need to be transitioned back home, or they're in a very tentative environment, meaning they are being housed in a hotel and trying to find the appropriate next steps for those children. They're really looking at TREC as a possibility to best support those youth. Currently, we only have out of a small number of kids that they would consider high priority youth. There's about 10 in the state that they say are high priority, and that's high priority because of need, high priority because of cost, and high priority because of concern. So like you may have heard of the youth that was in a Tennessee residential treatment facility, New Hampshire youth. That child was brought back. That's one of those high priority youth. And how do we best attend to those youth? So we meet.
Are you saying to me that they're sort of looking at individual individual resource, 24/7 type programming that you guys would oversee?
Not that we would oversee 24/7. They're overseeing the 24/7 resourcing. So like if they have one of these children that are in a hotel, they have DCYF staff who are there 24 hours a day with that child.
Wow.
What we are being asked to do is the TREC practice, coming in, starting to identify for that youth. We're not doing any of the staffing of children there's a facility on the Sununu campus. They call it cottages.
Mm-hmm.
They've started to use, in my mind, in an inappropriate way, they start to refer to that they're cottaging children, that they put them in these holding places and hotels as well. But we are not doing that. Our role is to come in and provide the care coordination. And we have not had there's been not an inkling of, could we do something like that? Where they've been saying is, what DCYF is saying is TREC has been successful with other children in the state. Why should we not be looking at having these children be in that TREC practice so that they can best have their care coordinated as well?
So another question I would have is, would that be a higher level of care oversight that you would have? Because everybody, when you have a caseload, you've got your high-end cases that need you all the time. those that need you some of the time, and some that just run themselves and you need to check in with them. But that high-end thing can take all of your time and really make it hard for everybody else, and if all of a sudden you're taking these on, is that gonna have to be a separate situation?
I don't think so. One, because of the 10 cases, the 8 to 10 cases that our coordinators would be carrying, all of them are high need.
Yeah.
And currently, these cases, what we're really finding is DCYF has to do a better job on their end first.
Yeah.
Because they'll say, okay, here's the youth we want you to work with. We assign a coordinator, that coordinator starts to reach out to DCYF, reach out to the family, reach out to the youth. And we're finding that the coordinator is being frustrated by the fact that the family doesn't even know we're even being asked to do this, or the youth is not engaging. So at this stage, there's not a lot of work that we're doing with these cases because of DCYF's inability to have upper level management who are identifying these youth, have a better trail down to those on the ground staff working with those youth. That is being worked on. That's what we're recommending to them. I met with the Bureau yesterday to say, we need to have better communication, better collaboration prior to us even being involved. So when we get that case referred to us, the family's aware of it, the youth is aware of it, they understand what we're gonna have, they have a cursory understanding of what we would do to help them.
Okay.
Is there, I know you've been working with Daryl to get more funding for the truck.
Yes.
There's only, is that part of this as well? Does it look viable, or does it look like it's still something that,
I think it looks viable, but it is something that I'm constantly on.
yeah, because there is only so much funding for being able to bill for the truck cases.
Well, isn't the
So,
expect,
that's
but,
what
but,
we're
I mean, right, if you reach that limit, that doesn't mean that,
We can't stop,
right, like, you can't build a wait list, right? Or can you?
no, because there's only a certain pot of money.
We bill for whoever we're assigned.
Yeah.
Now, we have children on what's called, and I think I have a slide coming up around this, on what's called the interim support list.
Mhm.
So but those are youth that are fast forward youth in the wraparound practice.
Correct.
The track, we're picking up immediately.
Yeah.
But track is, you only have a certain amount of money that you have up to. When you get to that limit, that doesn't mean you stop services, correct?
Correct.
Right.
And it's DCYF, you know, because this has been an ongoing discussion for the last 2 or 3 years, where it's like the expectation is that we continue to do the work even though the money's not there, correct?
Yes.
Because we bill the truck through the contract.
Mhm.
It's a separate pot of money, not a Medicaid billing.
Okay,
So
what-
that separate pot of money covers a lot of contract, a
yeah,
bunch of different things, so.
okay,
But what the state has also done, and to their credit, is they've allowed us to move some of these youth onto the Medicaid billing. So that we move it into what's called TREC community. And when it's in TREC community, so when that youth is not in the residential facility, not in Hampstead Hospital,
Mhm.
when they are at home, still receiving those TREC services, we are then able to bill them at the full rate for the full amount of time. So it does cut into that concern.
okay.
This gives you just a quick overview of the budgeting component year to year. This is based on the same structures we've used in the past. So Delana was pulling the information in the same fashion. So I feel confident that it's pretty close, if not completely accurate. As you can see, the 2023 figures there are through the end of December. The one figure at the very bottom is the contracts figure of 1.15. I think that doesn't include the 700,000, the 700.
No, it does not.
Yeah, so there's additional monies coming in through the contract, but they are monies that are going right back out too.
How were the rates established?
They were established, so the way it works for us is they're established that if we have a youth, that youth receives it initially, it was like $72.30. And that is a daily rate for the life of that care for that child. And in building that rate, the Bureau started with, okay, what should it cost for the care coordinator, so it's covering the cost of the care coordinator. What should it cost with respect to additional things that you may be doing with that family? So let's say, you know, I'm working with Jim's family, and you work for Monadnock Family Services, and you work for Monadnock Family Services as well. If both of you are coming to the meeting, one of you can be billing through Monadnock Family Services, the other cannot. But we know that the collaboration is critical. This allows us to pay for the other person. So we, in working with Monadnock Family Services, we support them to bring that other person to the table. So there's what it's called is customizable goods and services. So if we had to do something additional to help that family get over a hump, we had a family that was in the shelter in Peterborough, was getting out of the shelter and then moving to Keene. So we were able to, and part of it, we're not just then saying, here's a check, go do it. We're also trying to find ways to do it. So we actually hired the swamp bats to go physically move the stuff out of the apartment into the truck. We rented the truck, so we paid for the swamp bats and the truck. The family gets moved to Keene, they move it out of the truck into the apartment. And so we're finding innovative ways to, you know, how do we accomplish these things? But that's what those additional fundings, like that additional, you know, when it was $72.30, the 30 cents was meant to be for the customizable goods and services.
So this is like a bundled sort of.
It's a bundled rate.
Yeah, okay.
It's supposed to include, you know, professional development,
Right.
all the things you need in addition to the actual.
And we were very blunt back in the day. I mean, I remember Dennis and I, you know, and we, at least I know I made it because I was on the committee back then, the steering care committee, that when the grant ends, we don't have funding, and when Erica and all that, we said we needed to have a real rate that's gonna generate revenue to be able to afford to do the work that we're doing. And we were able to negotiate a rate with the state of New Hampshire that has only increased over time.
Yeah,
And is there still funding that's vulnerable to expire other than the daily rate?
So this, what Dennis is referring to now is the rate for Fast Forward, which is the wraparound program, and it operates a little differently for Trek. So I think that's part of where the Trek program isn't nearly as
the initial thought for Trek,
robust financially.
the initial thought on Trek was it was about helping the kids in residential treatment get back into the community. And
Get back into.
into the community.
Okay.
So the thinking was it wasn't going to take as much work. So we're gonna pay you 3 days, it's 3 consecutive days out of 7 for that work. We have found that the load is equal across both. That's when and we, you know, our feedback to them is we've got to get more funding here. It wasn't just us saying this, it's NFI saying the same thing. And that's when they were able first to say, let's get this community Trek, you know, Trek community in place. So that's been able to do it. So they've been pretty responsive, and I think been very focused on continuing to make this work. They found it to be very helpful. Jim, do you want to touch on just evaluate some pieces at this point?
Sure, I can do that. So I thought what I would do is just show you some of the referral numbers. I have a little bit of information on outcomes if you want to see that for each one of the programs as well. And if you have other things on your mind, I may well have some data I could show you on that too. Just make sure I get it right. Let's see. All right, seen that okay? It's a little small. I'll kind of read it off to you a little bit, but this dashboard shows the referral kind of current status of all referrals since Connected Families became a care management entity on the top. And then it shows you the pattern over time down below. So since essentially like September 2020, is that when you became care management entity, Connected Families has received 597 referrals. So we're talking about, you know, about 200 per year. And just to give you a sense of when I say referral, people who are referred for both programs, Fast Forward and Trek, The referral actually goes to the Bureau. They do the intake and eligibility on those cases. And when they are deemed eligible, they pass them along to one of the two care management entities. So these are essentially pre-screened for families that are eligible and at least at that point are expressing interest in enrolling. The only exception to that is for the grant-funded program for the birth to 5 population, where Connected Families is doing their own intake and eligibility because the state doesn't handle that. It's not under their purview because that's a grant, a federal grant from SAMHSA. So most of these are coming from BCBH. We pulled these numbers yesterday, so this is pretty current. There's currently 3 TREC cases and 3 wraparound cases that are accepted by Connected Families. So they've been sent over by the state, but not much else has happened yet. There are 51 TREC cases enrolled and 50 wraparound cases enrolled. So I think one of the things that's a little different about Connected Families versus NFI is that, so NFI's practice is much larger and they cover a broader portion of the state, but their numbers are slanted more toward fast forward, whereas Connected Families is about, this is usually what we see, their enrollment is about equal across the 2 programs. And so in some ways, that's a relative disadvantage financially, I think, for you guys, because if you have a greater proportion of those TREC cases and the rate isn't as good and there's constraints on it, it's not as ideal. There are families that get referred over that don't ever actually enroll. In other words, they don't ever meet with the care coordinator and sign the consents. And you can see those here. It's actually not a tiny percentage of these cases, even though they've already gone through intake and eligibility with the state. And then you can see all the folks that have been discharged. So 224, we usually use the word wraparound instead of fast forward, but that's what that stands for. And TREC. So, 224 have been discharged from wraparound over the years, and 146 from TREC. TREC is, as Dennis says, it is not less intense work, but it is shorter duration on average than fast forward. And also, though, those cases are more likely to kind of recycle through, very often they'll go into fast forward after being in TREC, and they're just more likely to get more additional services. So they're fairly high intensity in their own way, even though you don't get the 2 or 3 year long enrollments that you sometimes see with fast forward. You can see the trends here. It's about 15 referrals a month. You can see there was a period where it was considerably higher than that. Can't see my dates anymore, but that's, I think, in 2021. It slowed down a little bit more recently, so you're seeing fewer months where we get these big spikes. So
What's the bottom color represent?
oh, so the gray ones are ones that are referred and that are never actually enroll, so they don't end up being served through Connected Families, and the green ones are the ones that ultimately enroll in one of the programs. So you can see, obviously, the more recent ones, there are some where we're still trying to get those families into enrolled in a service. Oh, sorry, and I skipped one thing up above, the ISL list. So Dennis mentioned this before. This is kind of a supported version of a wait list for fast forward families only. And there's 23 youth and family on that list now, meaning that they've been accepted. They're interested in enrolling, but there's not a care coordinator available. At this point, the coordinator's caseloads are full.
Is there a common reason why someone would be referred but decide not to participate?
I think Dennis would speak to this better, but I think the most common thing is that folks get referred over and then just don't respond to attempts to outreach to them. And these families' lives are really pretty complex, and I think a lot of times something happens and they don't have the bandwidth, or maybe they get another service and they're doing okay, and they decide, I don't really need to do this anymore.
Do you see any, seasonal or pattern?
There's a little bit, like, you tend to see a drop off in the summer, you see an uptick around October. Usually, you see like February, March tend to be an uptick as well. So I think a lot of that is like the rhythm of the school year. And maybe kids popping, at various times a year, and then summers being generally quiet. Is pretty typical. We see cases that they also don't engage as readily during the summer months. But you can see it's not one to one, like, it's not always the same month every year, but usually it's like February, March.
What's the interval for these bars?
Everyone represents a month. I'm sorry, you can't see it because of the tabs here, but the months are displayed in this, but they're hidden.
So from I'll say, a research point of view, is there any, feedback loop or analysis, with respect to the effectiveness of the outreach to improve the pickup rate? You know what I mean?
Yeah.
In other words, are we doing enough to recognizing their lives are chaos?
Yeah.
To, I mean, in a way, this seems like quite a jump. If these lower bars reflect the decline.
Well, some of what that's reflecting, Jack, is the kids that are now on this ISL list. So they are being served. They're not really enrolled in Fast Forward. They're not doing the full program. They do get family peer support during that time, and someone from Connected Family, one of the administrators or supervisors, kind of checks in with that family. Maybe you want to describe.
Well, what we've been really,
It's not a voice.
So they're in the gray area, because we're like, well, they're not actually like partaking in Fast Forward at this point. They're just on this interim kind of support status.
and we
Okay.
as a county are paid for those cases when they're on that interim support list. So it's been an area of concern of ours to say, okay, we're getting money for this. What are we doing for them?
Right.
And so one is we have an intake coordinator who starts that process with them. And we have been now looking at how do we beef up her role in that involvement. You know, early on, when there wasn't that interim support list, she was just going in and saying, I'm gonna meet with Terry's family and I'm gonna get their consents done, you know, get all the paperwork side of it done. Then the coordinator can immediately pick up. Now we're saying, okay, there's a bit of a lag there. So have her come in. What else can we have her do to start to help that family get engaged?
Got it.
The second piece of it is that family peer support. So NAMI has that family peer support that gets assigned to that case. So that person's checking in with the family. And then as you recall, back, I'm trying to think of when it was, I think it was early September, we talked about having this new clinician come in. Trinity Early, she was our Northern Regional Manager. She was our internal analyst. Now she's a part-time clinician. She's just cleared all of the hurdles of getting her license in place and supervision and all that. She gets the supervision towards her licensure, but she'll start to take on cases from that interim support list as well. So that coordinator will work with her. So we're doing more to try to figure out, to your question, how do we engage them?
Got it.
And are there things that she can do that in a brief therapeutic way to be able to say, you know, are we giving them enough? And that might be enough for them to move on, you know? So how do we just keep working on that list and helping those families see what we do and how we do it? And can they be better engaged when they get fully connected to us?
Got it.
And the context happen, I mean, when a family doesn't engage, it's not because they're not being outreached by the program, it's, you know, the multiple times.
Right, no, I
Yeah.
appreciate that.
Yeah, it's just, I think, oftentimes families are overwhelmed and they just can't take the steps, even though it's kind of set up for them at that point. Just show you a little bit of demographics, so you have a little more sense of some things about the population. So remember now that with the grant, we're going all the way down to kind of birth to 5, so we're starting to see some numbers pick up there. This is 4 in the 0 to 2 age range, 25 in the 3 to 5. And then you kind of see how it just kind of escalates 6 to 8, 9 to 11. And then really most in the 12 to 17 age range. We find the Trek population is a little older than the fast forward population, which makes some sense because those kids have been typically in or are seeking residential treatment, and that tends to take a little longer before something like that would happen. It doesn't tend to happen with the really young kids. About 7.2% of the population has been Hispanic, Latino or Spanish origin. Race predominantly white, 3.1% Black or African American, more or less tracking what the region actually looks like. Gender identity, you can see, predominantly male. That is very typical, especially for fast forward wraparound programs across the state. It's about what we usually see, around 2/3. Most of the rest, girls, and then we get some kids that identify as transgender as well, or some other kind of gender identity. So this one is kind of interesting, pretty high rate of youth saying that they don't fit into any of these categories. It seems to be a little bit more common with the Trek population, and I suspect that's because they're a little older. So they're more likely to be at a point where maybe they're questioning or trying to figure out their gender identity. And then this is just kind of a proxy for income, and just to help you see the percentage of families that are taking part or enrolled in various kind of social safety net programs. This should say SNAP. We don't use the term food stamps anymore, but they're mostly enrolled in Medicaid, and that, of course, is essentially a requirement for fast forward. I know the state provides some flexibility for kids that they can't get enrolled, or at least to start the program prior to getting in Medicaid.
If we don't, if the family is not on Medicaid when we start working with them, the state will decide, are they eligible or not? And if they're eligible, and it's really, the eligibility is based on, not on the Medicaid status, the eligibility is based on the need. But we will then engage with the family and work with them to apply for what's called HCCSD, home care for children with severe disabilities. So that is the ability for them to be on Medicaid based on their disability, not their income. So
Is that
formerly known as
Katie Beckett?
Yeah,
That's what I thought.
we don't use that word.
So do you, quite aside, do you draw any anecdotal kind of conclusions from the fact that 17% of the clients served don't affiliate with I'll say the historic gender categories?
Well, I mean, we know in general rates of mental illness are higher in that population, and struggles with peers and struggles in schools. And so it's, probably not surprising that we see fairly high rates. So one is just decline, where they're just saying, I'm not willing to answer that question. So we can't really assume these are folks that don't identify with one of these categories, but they're, for one reason or another, are just saying, we're just not going to answer that question.
I'm actually surprised, but I actually think it's lower than, what I would thought it would have been. From what I'm hearing in the schools.
Is the transgender boys / men 1.7 or 17?
1.7.
One point, yeah, sorry.
I would just totally full of these.
Yeah.
Listen, but when I grew up, those are the only options you ever had, ever. And so, everybody was here. And so just as a cultural thing, we've got, almost 20%
of people that don't care about.
That are not choosing one of
Yes,
those two.
which, you know, is a cultural evolutionary
Well, it's-
indicator,
yeah.
is curious, isn't it? And because I'm always raising the issue whenever we have grants or forms or whatever. What does it matter? What does it matter? Why do we have to pigeonhole people into one category or another? And it's obviously an archaic, church-related, designation that happened centuries ago. And
Oh, the same goes for race.
yeah, and we just kind of perpetuate
It's a difference.
this interest in whatever this is, right? We know it used to be, but whatever it is. So it's a fascinating.
Well, to your point, is the perpetuation of that. What we have had is more anecdotal, because Jim is, you know, through your data, has shown us that it's not, there aren't disparities coming out with respect to the transgender population. But we are finding more transgender youth or youth that are considering these things in that TREC population. And that TREC population are kids who are needing residential treatment or psychiatric hospitalization. So what is our society saying to them? And what is it putting out there to allow them? I sit on the policy committee for New Futures, and they asked me would I be interested in writing a letter to an op-ed. And I brought it to Chris to say, okay, I don't want to jeopardize this program by putting out a letter, you know. So he said, bring it, you know, come back to him and we can work through that if we even want to consider doing that. Because it gets so politicized. And that was my major concern around, you know, I strongly believe that we need to, you know, these laws that are proposed that are being, you know, talked about right now.
Hundreds of them.
Are really, in my mind, problematic, like and I agree with your point of view, it's like, you know, we continue to think this is a binary question.
Which has value, which has an underlying purpose. I mean, and I'm just not sure what the purpose is, other than it's historic, it's antiquated, it harkens back to norms that are at least 100, if not older.
Well, I mean, it has value from the perspective of someone that's about to work with one of these youth.
Well, I
How
agree.
they identify,
Yeah.
and that's the main
Sure,
purpose here is,
sure.
we wanna get a sense, or you wanna get a sense, the coordinators, like what's happening. And
Yeah.
let's face it, these categories are still dominant, and when you don't identify in one of the traditional categories, it's still,
Right.
you know, you face different challenges.
Yeah.
So it's helpful from the perspective of just, who is this kid? How do they see themselves?
I agree.
What might be important in their
Yeah.
life? What are some of the cultural
Right.
issues that might be impacting how they're doing?
Right.
Following up on Jack's comment and subsequent discussion. Having been a physician for 35 years, now retired for 12 or 13 years. And having attended many medical conferences per year. It's only in the last 15 years that there was mention of this quote, other unquote identity.
Sure, you wouldn't get asked, there wouldn't be other categories.
Yeah,
right,
Like, it would be boy, girl, and
Yes.
we
that's
have a
it.
different question that asks about sex at birth. So that's kind of how, what was the sex you were assigned at birth? But then how do you identify, which is often different than that.
Right.
So it's really a two-part question.
Were we even asked that question when we were that age? Or wasn't it just?
Well, I think it was so
It's obvious.
ingrained in everything we did for every purpose, that we just become numb to it. I can appreciate that from a clinical assessment point of view or a socio-psychological approach. That 17% is very important, because that can be at the root of a lot of behavioral issues.
And similar to, I remember as my daughter was looking at schools, you get the information when you're at the visiting day. And they say how many youth are, you know, how many male, how many female. And I said to the the admissions vice president, when she was asking for more questions, I said, well, you ask a binary question, how many are you telling everyone they gotta fit into one of these two categories?
Right.
Instead of allowing them to see that they could belong here.
Right.
But when you only say you can only be one or the other, you're sort of saying, well, we're not really interested in counting you.
And in that setting, it's almost irrelevant or prejudicial. To even present that for some reason, but obviously. These whole things are changing.
So this is just a little, I know Jack had some interest in kind of the outreach, and this just reflects a little bit of what the typical kind of timeline is for a family once they get referred. And this is just for fast forward. This does not include Trek, because Trek, the process at the state works a little differently. But from the point of the referral to BCBH to the point of determining eligibility on average takes about 19 days. So, 2.5 weeks or so. From that point to getting assigned a coordinator. So the referral is eligible, comes over to Connected Families. How long until they get assigned a coordinator? That's a couple weeks. From that point, how long till they get enrolled? So enrolled means you have a coordinator and you've done an initial meeting, you've signed the consents. So we're like another 2.5 weeks. So if you add all these up, right, we're at, about 5 or 6 weeks. And then from the point of enrollment to your first team meeting. So if you recall, so one part of fast forward is to configure a support team, basically around the family, consisting of professional supports like therapists, etc., teachers, but also natural supports, extended family or coach or whoever other important people in that youth lives to really help them figure out how to get their needs met and how to execute their plan of care. So that takes around 90 days on average. The kind of gold standard in New Hampshire.
90 additional days.
90 from the point of enrollment, so the point that they sign the consents. Yep. Which actually is pretty good. The New Hampshire standard is 60 days, which no program in the state has really frankly come close to. So this time used to be about 120 days when Connected Families first started. So it keeps kind of moving in the right direction and quicker to get to those teams, which I think, is where a lot of the power of the program comes beyond just, having that one-on-one care coordination.
We think that, cutting down on that time period would give you more success.
Yeah, and there's like a lot of things that you have to accomplish before that point, and so that's part of why it takes long, and then the other part is just assembling the team and scheduling meetings and having everyone in the same, it's just practically difficult to get a whole bunch of people together at the same time, same place. So those are the things that the coordinators
Here's
struggle with.
problematic. Once once school closes in the summer, to get a team meeting together for that period of time, it's really hard to do to have anybody from the school systems there.
I think one of
So
the
that's skews everything.
coordinators, and ideally, like, these teams are supposed to be very representative of all the different roles and blah, and I think coordinators have found it's better to just get into team with the people you can start with.
Right.
As opposed to waiting for the perfect team to, so just kind of get in there quicker and then build it over time, so.
If it starts with enrollment, the call is, if I'm working with Chris's family, I make the call, we set up the meeting. So we start meeting, the coordinator meets with the family, and they're meeting with the family constantly, at least likely weekly until they get to that 90 days.
I'm gonna have to leave in like 5-10 minutes for an 11.
Okay.
I could send couple slides of outcomes. I just don't want to get into because
Yeah, that's fine.
And Davis has this electronically, right?
Not yet, but we'll send it.
Okay.
he doesn't have the slides because I was in my data viz platform, but I can take some
If you could
I
send
can
it,
export.
yeah, that'd be great.
This next slide just gives you a picture of, the staffing pieces. And as you can see, retention is critical. The last bullet there that says review staffing struggles from this year, we had 7 coordinators left in 2023, six new ones were hired. So we're down 1 on that, but we just recently hired 2 more who have January starts. So that's a good next step. Feedback in this process is critical. As we're developing this, we have to constantly be hearing from everyone to understand what's working, what's not working. We have the statewide network around the system of care work that is critical. So that advisory board is there. There used to be several different meetings that are happening on a monthly basis. Those are evolving. So we're sort of at that 10-year mark for the county. It's been about 12 years for the statewide work in the system of care. And so there's a whole new evolution to determine who should be meeting when around what issues within the state, because the group has grown. And they've got, some of these meetings have gotten too big where you're not really accomplishing much. So that's the next piece of that. Regionally, we meet as a care management team. We bring in, our goal now is to bring in one of our partners every month. So this month in January, the Bureau is actually who's coming to present at our regional meeting. We have monthly and quarterly evaluation meetings. So that's where Jim and his team get together with our supervisory group. Or we have a quarterly full team meeting where we'll be reviewing things with the entire group. And there are other collaborative meetings with regional initiatives.
So is it fair to say that over the last decade, there's been 20,000 clients served roughly? Few.
I only talking.
When you say
500
20,000? No.
200 a month, or was it 200 a year?
200 a year.
Yeah,
Oh, yeah.
it's about 15 a month. Yeah.
So it's still 2,000, 3,000.
But it's not-
That's just connected families, and
Yeah.
NFI is about, I don't know, they probably have at least twice, they probably have more than that. They probably have about 3 times that number.
But are you just saying family? Are you saying individual?
Yeah, we're counting based on the identified child that's referred, because technically it's the child that's enrolled.
Because
so-
Jack, that's where you start to get to your number is,
Yeah,
because
multiply.
you're talking one child that comes from a family of 5. They keep multiplying it, and that's the effect, because you can't just say it's the one child,
And I mean, when we think about this really broad concept that the children of the future, get them early, provide all of these services, try to help them be functional, healthy, balanced, so forth. In terms of generational changes for, all of the things we measure. It's really a potentially big impact, a generational impact.
Well, in all of this system of care work has not replaced anything else.
Mm.
That was the focus, is all the other organizations and services continue to do what they do.
Yeah. Well, it actually builds on things, though, that were there in the past, that when mental health started to get hit by funding cuts, they went away because anything that was progressive and thought or, when the funding just stopped. And so you had to just focus on the main core and not all these other things that you could do that help the main core. And I think birth of 5 is critical. I think getting that in there was a success. I think too that, and I've said this before, you're keeping kids in the community in giving them the best chance to stay in the community and not be sent into out of district placement. This splits communities all the time at wars. It pits neighbors against neighbors because of all of a sudden this child's sent into this residential and educational that also bumps up the budget in the school district by $300 or $120 to $300,000. And then, but for us, for our purposes too, it's a continuum of care. And that's what I think gets lost sometimes. We're doing this work now. We hope see them in drug court. We hope we don't see them in our sheriff's department, our county attorney's office, our Department of Corrections, or behavioral health courts, because we've done the work ahead of time. And I think that's one of the reasons why the county made that decision. And it's a program that pays herself and then gives back. I mean, it's a win across the board.
I moved up to this.
I'm sorry, I'm
Head
gonna have to
another
duck
meeting.
out. I've got
Yeah.
a meeting at 11. I gotta run to.
Thank you.
I'll
Thank you.
send a few slides, or we can add them to
Yeah.
your slide deck.
Yeah.
And I'll put some notes, so.
Great.
they're set for me.
Thank you.
All right, sorry about that.
Thanks, Jim, no.
Thanks, Jim. Sorry, to go back, so the challenge is, this population is the highest need, so really, training staff, helping them get up to speed. The data that I put in the second bullet there, where it's 15 getting to residential treatment facilities, that's last year's data, so I forgot to update that. But getting youth into a facility when they need a episode of treatment is still a massive challenge. We have kids, it's just taking too long to help get them to where they need to get to. But
Those sorts of settings are what, Hampstead or?
well, Hampstead is,
Something like
Hampstead is,
that.
well, so the state in designing this as from a system of care has designed it to have 5 levels of residential care. So level 1 is a foster prison. All the way up to level 5 is Hampstead Hospital. So the residential treatment facilities are in between there.
Okay.
In what levels of that?
There's programs like the Deacle Residential Program and others throughout the state of New Hampshire, but because we've lost some of the programming over the years, it's getting harder and harder to find placement. So that means that child that we want to keep in our community, or at least in the state of New Hampshire or in New England, is now going to Kentucky. It's now going to some other places.
And we have,
And we're paying for them to come back for the visits and then go back
Oh
again.
my gosh.
we're down, the good piece is, we have only, I think right now, between both care management entities, under 5 youth that are placed outside of New England. Now, there are other youth that DCYF has placed outside of New England. But the care management entities, it's a very small number. But having the availability of resources, so the other thing that exists now that you may have heard about is a PRTF, Psychiatric Residential Treatment Facility. So Hampstead is the hospital setting, and all their focus is stabilization. Get them stabilized back in the community. Then the partial hospitalization actually exists on the Hampstead campus. That is a 12-bed facility that's full. They opened it, it was full within 2 weeks. So that's the constraint of that. And some of it is also the constraint of, you have these children with such high needs, they can't have a roommate. So that room that was designed for 2 youth only holds 1 youth. So there's complexities in there. This, I did this last year. This just gives you an example of one of the children we're working with. It shows you the complexity of the case. I'm just gonna use water, sorry. But as you read through it, you'll see the complexity of it, and then as you get to the end, you'll see you wouldn't necessarily say it was a great success.
Yeah, I see it differently on some levels. I see it as you were able to work the process out so that the decision could be made that this is the last final step we need to take and move them into foster care. I mean, sometimes that is the answer, but it sounds like it was a thoughtful process of trying to do everything you could to get to where you needed to be, and it couldn't, so there was a decision made that they needed to go into foster care.
Yeah.
I mean, sometimes hard decisions are, it's not always that, you know, you were able to work with the family and everything turned around and
Right.
rosy, and sometimes reality hits that, that's the best case scenario.
And, you know, and the other thing that happens in these situations is the staff gets subpoenaed to court, you know. Those aspects bring you into a different level of this, but I would agree, Chris. I just wanted to make sure we've given you the full
Yeah.
picture of sometimes you can work for a year and feel like now, and you know, and that the staff person who's working on this case was, you know, devastated when they found out, okay, now the family is, these three have to pull the children.
Yeah.
But the father is still struggling with mental health issues. The mother has been very unstable herself. And hopefully, you know, over time, they can easily come back to us.
Yeah.
Do we have it seems as though foster care has a shadow over it from horror stories. Do you have a sense that foster care has evolved a bit to be a little more predictable and healthy?
I have sort of two opinions on it. I think that naturally so, we only hear about the worst case
That is true.
situations. And, you know, one of our staff in Claremont is actually a foster parent who has been fostering children and now has adopted one of her children. That she has two of her own biological children who are junior in high school and one's in college. But you see the real deficits when you hear it from her perspective, because she sits on a statewide advisory board. And I would say, you know, that's one factor of it. The second factor is, I think, and this is something we've been pushing through the policy committee of New Futures as well, has been, we need to address respite. In foster care is in that same category, but right now, the financial rate, if I said, Jack, you're a respite family, can we have this family come to you this weekend? We could pay you. I think it went up from $20 and something to 30 something
A day.
a day.
And this is the same story we hear from the Monadnock Developmental Services when we give them the monies for their respite programming that they do. And is that it's the rate is just, it's
appalling.
and the need is so massive.
You're saying, I'm
And
saying.
so the hours go down if they give more money. So if they give them $20, they can get up to, you know, 8 hours a month. But if they give them $30 or $40, now it's $4 hours in a week, a month. I mean, and it's just.
So it's really just intended to pay for some extra food by the sound of it.
And it is, these are the most, the families with the greatest need. And we're saying we're gonna pay you $35 a day. And I said that to the Bureau. I said, this is, you know, they said, we have options. And I said, we do not have options. This is unrealistic to ask anyone to care for any child for, you know, what do we all pay for our own daycare? I mean, I still have children I need to pay for a babysitter at times. But I'm not paying $35 a day. This is appalling. And so that's one of the policy committee's challenges. We gotta change that.
And the problem is.
Kids, is it double?
It technically could be, yeah.
And that's for respite. But for foster care, are they getting paid?
They could be getting paid more than that. And also there are there's a different licensing levels.
Correct.
But the basic level, if I said, Chris, you know, your child, we're gonna have your child go to your sister's.
Yeah.
That's just family care, and they deem that to be.
And the problem with foster care right now too is that there's not enough. So the pressure on those that are doing the services to take on other children is there, whether that's right or wrong, it just, there's such a need.
Yeah.
So, and then push to adoption on some level too.
Right. And while we have numerous cases, and we're still dealing with a case that the adoption, it was a state adoption that had gone bad. And this family has now taken all the way to the governor's office and said, you know, we want, you know, so we're still working with this family to say, okay, look, we're not working with your child anymore. You know, we can't pay for X, Y, and Z, you know, and this is an educated, capable family. This just touches on some successes real quickly. The early childhood wraparound is sustained, you know, that is a huge achievement. So now we can support children from birth to 21. Our supervisor support, I think you recall, you you saw the change in our staffing, that's in place. We're developing that as it moves along. It's coming along well. And I think it really is helping spread out some of the burden and the load. And I think it's really continuing to push to now get the rest of our staff in place. Future planning is integral. We have a site review every year. We've been successful in those site reviews. Bob actually came to the site review over on West Street, back when we had it. But it really was, it's gone very well. You know, when we get the recommendations, they're pretty reasonable recommendations. We're not,
That was very interesting indeed.
but we're not feeling, you know, we're working on, you know, that next piece of the integration of documentation and practice. That is something we're constantly working on, in terms of how do we help people do their job and effectively document that work. So, and for the most part, you know, I would say 95% of our people are doing a great job with this. And we have to constantly, you know, there's always going to be someone you're going to work with to help them develop better work practices around this. Changing our coaching model with Trek is fully in, we're fully in development of that. So that will help reduce our costs in our other coaching work with UNH. We have testimonial videos up on our website now, so families have volunteered to say, yeah, I'd like to share my story. And then the other piece that I'm not sure if you're aware of, and I thought it was important to touch on is, so system of care, you know, we went into system of care focused on those highest need children in wraparound and what are those interventions we need to do. But the state has also put 3 different things in place. And so the first one is this new psychiatric, excuse me, the psychiatric residential treatment facility, that's in place and up and running. 988 is rapid response. So, you know, one of the major concerns has been, do we overload emergency departments with children waiting for care? So 988 allows them to do that. And I do have a slide here that gives you just some general data here, and I'll send this to you, but it helps you understand, you know, this is data from April. So I want to make sure I read it right. So from January 2022 to April 2023, 41,000 contacts were made. So this is if the family calls 988 or they call that 1-800 with their 833-710-6477 line, that gets them directly to one of the community mental health centers within the state. It shows you the mobile dispatches, and it shows you, you know, on average, 72% of the contacts resulted in a mobile dispatch. So that's when someone from the community mental health center is going out to families in their home environment. So it is diverting numbers of individuals from ambulance service to hospital settings. And hopefully we're getting them to a better place of care first. But this has been another major enhancement of a system of care. And I thought it was important to just make sure you understood that this is part of that whole system of care work that we're doing. The next slide touches on, so one thing that we talked about is the TREC, transitional residential enhanced care coordination. Prior to the system of care work, if a family needed care, the way for them to get care was to find themselves neglectful if they didn't have the resources. Now within the state of New Hampshire, we have the ability for a family that we're working with or a family that comes to us, they can request a comprehensive assessment for treatment. And there is a private company that the state is partnered with called Maximus, and they'll do those assessments. So you can see that this is the total number of assessments. And this is data this is last year's data. So it's 1 year, 22 data. But there are 756 assessments across the state, not just our region. And 43 go to the highest level of need, 143 to the second, 375 to the third, and right down there. But what it's doing is it's allowing families to have their child's needs addressed, and their family is not put in further harm, meaning they're not charged for neglect. They're not in a position where they're really needing to do other things. Now we're actually developing a healthier system. And this
Is
just,
that regardless of ability to pay?
yes,
So these aren't limited to people on Medicaid, for example.
correct. Now, you could easily argue that a family with need is going out and buying their own care somewhere. But if we have a family we're working with who has financial needs, and they need a comprehensive assessment for treatment, we can.
Sure, because I can imagine even people with money don't know exactly how to handle some of these issues. I mean, it's not like
My comparison,
we all
because,
come with the answers because we have a checkbook.
yeah, well, my comparison is, because it's hard for people to understand what this is like, is that the children we work with are as if your child has cancer. The general public understands cancer and the needs of that. And they need, and many of them need basically a care coordinator or someone to really help them do that. That's what we're doing. The families we're working with our goal is to do what Chris is suggesting, is that if we didn't help them, their life expectancy is 25 years less. Our goal is that we're extending that life expectancy. And we're extending, for anyone with
Family's life expectancy or the child?
the child, anyone with a significant mental health issue.
And I think that we should just put out there too, is that if we can somehow get the restorative community level into the elementary schools, we've got it in the high school, we're starting to get it into the high schools. It would be a great breakthrough, just like Birth to 5 is. Because restorative justice and restorative community at the high school level in teaching this, it's almost too late. It's not too late, but it's almost too late. If we could, have kids start to understand that process earlier on, I think it would benefit some of these kids and may not put them at the risk that they are, with the process that we could put in place.
And with the wrap up of our current grant, SAMHSA has just put out a proposal for another level of grant. And Jim has reached out to us, and Suzanne and I met. We've conferred with Chris. We believe we should look at applying for it.
Sure.
One, because it provides, I remember working when our first technical assistant person on this grant was the woman who started the system of care work. And she was great because she would say to me directly, Dennis, this is investment capital. This is for you to test things out, see if they work and get them put in place. And what Jim has really touched on is, the data that we're collecting is what will really tell the story. And so how do we look at that? How do we look at in-home supports? How do we look at what else can we do in our community to better support the children so that we're, as you're saying, Chris, could we better support restorative justice? Can we better support kids getting the services and getting the other activities that they may need? My child goes to, soccer in the winter. So shouldn't every kid have that opportunity? How do we push that conversation?
Can I ask a question about the grant? So the grant, the SAMHSA grant right now that has some funds left.
Yeah.
Did I hear Jim say that the SAMHSA grant handles birth to 5 year old? Is that predominantly what is covered, is the birth to 5 years?
Birth to 5, the in-home support work in the MTSS.
So I do know that there's some Gopher money or ARPA money or whatever that was also given through the state contract.
Yeah.
For birth to 5.
Yes.
And that will, I can't remember when it expires, but I don't know if it expires June 30th, 2024, or if that's the one that has a little bit longer.
I thought it was the end of, but it may be June, I'm not sure.
Okay, so when that expires and when that grant expires, if you don't have another grant that you have the ability to go after, then what happens? Do we still serve that population? And there would be, I guess, a billing to Medicaid. So we don't need any general fund dollars to supplement. It would just then transition to billing to Medicaid.
Yes.
Okay. This just defers the need to have to tap into state money by continuing to get grant money.
But it really is now asking the question, what else, what could we do?
One more follow-up question, only because I heard him say that the state, because the state doesn't fund the birth of 5-year-olds, they don't get involved in the initial intake evaluation. But so the extra money that they're giving us through the state contract, which is state money, they're still staying hands-off just because they're considering that kind of as another supplement to add to our.
We work really in collaboration with them.
Yeah.
You know, we're, because we need to count the number of children that because you may get a referral and you say, oh, that's not appropriate, but we can still count that as a child we touched. You know, because Sampson wants to know how many children are you touching? So that's what is happening, but the Bureau, if they get a referral for a birth to 5 family for our region,
Yeah.
they'll send it right to us.
Okay. Wrap my head around.
Anything else, Dennis?
I don't think so.
Any other questions from you all?
No, it's so wonderful.
Thank you very much. Great program. Keep up the fabulous work.
Really appreciate all of what you do to support it, and especially the finance department is great, and I think we continue to get better at how we're doing our work with them. But, yeah, thank you.
Thanks, Dennis.
Yeah, 17, yeah, we're on.
We're gonna move on to master agenda item, Emerald.
I still think
Right on.
Oh, okay.
Just my
next year we should
evaluation of
actually
where
think
I
about
things
adding
are
FTE to finance.
Missing in expenses.
Okay.
I might be wrong.
Wouldn't hurt to have
Focus on.
a deeper bench and a little more cross training, and I think she's probably headed that way, Pat. I'm just concerned about the longevity of the workload.
Yeah. Master agenda item 1149, recipient of the Hemingway distribution. Cheryl, you're gonna talk to that. It's a little late, but she can explain the rationale behind that.
Yeah, so, we actually.
We usually get the check earlier than this.
Yes, so, we received an email from, Kendall Lane's office, who's the, overseer of the Hemingway Trust earlier in the year. Basically letting it be known that they're having to restructure the trust. I believe it's because the town of Marlboro,
It had to do with Crotched Mountain.
Crotched Mountain.
And how Crotched Mountain was bought out and that new company came in and they were getting some of the funds to they had to redo the trust pertaining to that.
Right.
So anyway, yeah, I didn't, his original email didn't make me think that it had any bearing on us getting the distribution. It said it's not gonna impact the distribution, but it did definitely impact the timing.
Everybody will get a little more.
Well,
No, it didn't mean that Crotched Mountain, that funding stream stops, just they had to change the trust to reflect the new ownership because they're doing the same type of work.
Oh, okay.
yeah, so, anyway, we got
Yeah, I know.
$54.84.
I'm sorry, what?
27,000. 055.84. And I need you to sign the receipt that we received the funds. I just always have the government computers, and if you have any interest in looking at the trust backup, I'll forward that around. You wanna date and sign that, and if you wanna look at the backup, let me know, but just get it all back to me.
I'm the recipient?
Under the recipient, yeah. Just have to return. And then we'll be getting our normal distribution in a time fashion right around February, March of 2023. So you'll be seeing me come back not too far in the distance, 2024.
You did it all?
Yeah.
Mhm.
But.
So once you had, that you're all set with that then, once they sign it?
Yeah, I don't know if you have any interest in knowing what the balance is in the account.
Yeah,
I think,
I think I have an idea,
yeah,
but
roughly.
another 27 on it.
Yeah.
This is a fantastic.
I say 60 some, 70, right around $70,000. Because
We
we
actually-
used it
Yeah, we used it, but so far we haven't used as much on the house, on the EMS that I thought.
All right.
So, so we have 153,000. And I do need to go back to see if there's potential other expenses that are coming through for the house.
The White
But
House.
we used 10,682 for 100 nights this year,
Mhm.
to help with housing of people. Is that what it was?
Yeah, it was, the last 3 years, they've come to us and said they've had to house people at Keenan for a certain period of time, and we've paid for 2 rooms for like 3 months, 3-month period.
We used 60,000 towards Smart Ride.
Right,
And then it's been in this year, just rounding down or rounding up 63,000 on like Chris Cowing and stuff like that,
so we utilized a chunk of money for the
Oh, yeah.
White House renovation where we have
Right.
traveling nurses staying and living on the EMS, grounds.
This is the money that we get to use to pay for 100 nights, other sort of indigent, old, elderly folks. Unless they come from Marlboro, which they have their own pot of money over there.
Right.
So we've used this to house an old person in a nursing home, and they
Yep.
get burned out of their house or something, can't
that
remember.
house that floods.
Yes, but we've also done it more recently for 100 nights. Have come to us for about $9,000 a year, added on to what they're already getting to have, because they have more people than they can put at the shelter. And so they're at the Keenan or some other hotel, and we help pay for that 3-month period for those families. It's always been families that they've utilized it for.
Nice.
Yeah, we used
And
it.
we've utilized it for, again, the White House, which is down at EMS for the housing of travelers for our nursing home.
Yeah, we used it once upon a time to help save the AIDS house, and whatever town that was in.
Gilson,
Yeah,
yep,
so. Thank you.
okay.
I'm sorry, so the amount that's in there is how much?
150.
Okay.
153,381.46. So when we get our next distribution, it will probably.
Getting probably right, usually it's around, I always thought it was like around May, June, that you see Kendall walking down the hallway with a check.
I just always remembered February, March,
Uh,
and I remember Mike Bentley actually taking care of it, was he in the same office as Kendall?
No, that's his brother is in with Bentley,
Yeah, what's his name?
Judge.
Kind of working out of his basement, I think.
Kendall? Yeah, he does, yeah,
I think
yeah, I think out on,
you could tell from mildew smell on the stationery.
Yeah.
Not really. Anyway.
All right. Prior to us taking a break for Christmas, we had talked.
Christmas is already passed.
I know, we had talked about, and you had said that you'd be willing to step into the role of where Rod was on the Southwest Regional Planning Commission Board. And so we actually have to have a nomination process for that to recognize that you'll be filling that role. So that at their board meeting on the 9th, they can then accept that you're gonna be coming on and representing the county. It's just part of the process. So I just would need us to have a motion to move Commissioner Clark to represent the county on the board of Southwest Region Planning Commission.
I so move with enthusiasm and
And
vigor.
Jack seconds.
You have $20.
I was concerned. So,
Second.
Yeah, so there's a second. Any discussion?
yeah, when are their meetings?
Every day at 10 till noon.
Yeah.
No, it's once a month. It's the second Tuesday of the month from 3 to 4:30. Sometimes 5, but 3 to 4:30. And they're usually right here.
Oh, they meet here.
Yeah, a lot of times they're right here. They used to have
They're,
but because of the Zoom capabilities we have here now, they've been doing it more and more here. And so we said, just even with Rod leaving, keep it up and keep it, and one of the reasons I was on it prior to Rod, I was on it and for like 5 years. And I'm like, I just, with everything else, you just can't do it all. But they started doing it here too during that tenure, and then Rod kept them here, and then, so hopefully they'll keep that. But once I send this letter over, Tim will have your contact information and we'll reach out to you, Terry. All right, so Commissioner Wozniak, yes?
Yeah, yeah.
Commissioner England, yes, and Commissioner Clark.
Suppose he'll.
There's a majority anyway.
Too late, right? Okay, moving on, master agenda item 1151, just attendance of National Association of Counties High Performance Leadership Academy. Just to make you aware that I've asked Davis to sign up for, and he's been accepted into the NACO High Performance Leadership Academy in January. It's a program that I did 4 years ago.
Where is that?
It's all online. And,
Oh,
and
So you get to pack light.
yeah, it was actually great to be able to, it took me about 4 hours a week. But it was great to be able to have conversations with others around the country, other administrators, other commissioners, other whoever it may be, because it can be a mix of different people. And to hear from national speakers around the country from, well, now it's past, but Colin Powell and others, it was a great opportunity. So we looked at it, we thought it was something that was worthwhile. I've also talked to Davis about when Monadnock leadership comes up this coming year, that should be something that he should look at too, with all the community connections, and to learn more about the community as a whole.
Well, I wonder if he shouldn't do leadership in Hampshire.
I want to do Monadnock first. I want to get the community connections first. But we did talk about that, didn't we? We did. I said, first step, Monadnock, then leadership in Hampshire would be a great next step.
I did it in 2001. Like forever ago.
I think my brother did it. My brother did it like was one of the first class ever to do it.
And that 23 years ago. Leadership.
So next on the agenda is my report.
Surrounded by awesome people.
Want to make you aware that we do have two non-publics. I know Doug's still here, and at some point we'll bring him into that. And there is a non-meeting. I just want to make you aware of a matter in reference to union matters. But aside from that, my report is as follows. First of all, recognize the work that Terry has done, Commissioner Clark has done pertaining to Cheshire Power with the new press release that came out yesterday with the new percentage coming in at 8.1%.
26% increase.
Yeah. Which is a significant decrease. It's not just a decrease, it's a significant decrease. And I think the more we can tell that story out there and see what we're doing, I think the more people are gonna be willing to say that this is something that's worthwhile, especially other counties. I know other counties are looking at it, and I think one of,
Merrimack just joined.
did Merrimack just join?
Yeah.
Outstanding. So I think what I was going to do is send this out to, send the whole packet that you sent to me to Kate Morgan, who can then send it out to my counterparts to share with everybody across the board so that they can see where we're at with numbers and how we're moving forward. You know, and again, I know it's all about timing, but there's other communities. Right now, currently, it's the county. It's Nelson.
Dublin, Fitzwilliam.
William.
Okay, that have launched already. We're
Right.
Right now. February 1st, the new rates will also work with those towns. And plus Chesterfield, Winchester, and Roxbury. And then Gilsum will come in April.
Mhm.
And I'm gonna be meeting with Alsted in 2 weeks.
Yeah.
And Stoddard hasn't gotten back to me with the date yet, but contacted them. And I've got letters out to Hinsdale, Troy, and Sullivan.
Yeah, and I think one of the things that we should do along with my counterparts is to send that out through all the towns too,
Yeah,
and the city of Keene. I mean, I'm not saying it for, I'm just saying it for the fact that, you know, if we're gonna send information out, let's be consistent across the board. You know, and also our delegation, like we would anybody else.
I sent it out yesterday to the Sentinel, the Reformer, to the Transcript, and all the radio stations.
Yeah.
And there's already been, I guess,
KBT, Brattleboro picked it up already.
Yeah,
I was talking about it, Kathy O'Donnell told me it was all over the radios.
yeah,
Dan wants me to call into, open mic Tuesday at 9:10.
good.
Yeah, it's really, really great news. And that rate is the lowest, and it just continues to go down. But it shows that Calpine was right, you know, we have this company that does our rate analysis. And then last year, just after, PUC came up, excuse me, Eversource came up with a 20 cent, price. You know, Calpine reported to us that, you know, that right there was like a real fluke. And they don't understand why they did that, because nobody else did that from any other state, whatever. And they predicted rates were gonna fall when they gave us a chart. And they're following that chart. What's interesting is just about the same time, the city of Keene signed that contract with Standard, Electric. I gotta believe that Standard has their own Calpine to do that analysis.
I would think that.
Yeah, so now the city of Keene, all the residents in the city of Keene, Marlboro and Swansea, for another 2 years, are gonna be paying actually more than the default utility rate, which is the entire purpose of community power is to go below the utility rate. So I'm gonna put it out there that, you know, we are encouraging individual ratepayers to go to our website and to join up.
Because they can opt out of any system they're in,
Every month.
and they can join us.
Yeah, there's absolutely no risk, there's no contract, they can do it every month.
Can you opt out of a program you're in currently and then something goes back up, just to say, and they can opt back into that program?
It's like day trading.
Yeah, if you have a third party, if you have a third party contract, you
Mhm.
can. But a lot of these third party deals don't have contracts, they're sort of open ended. And yes, you can come in every time you get your meter read, you can go in, you can buy electricity anywhere you want. It may not take effect for a couple cycles, but you can do that anytime. And, you know, there's no penalty or anything, and there's no contract, so you can just keep on doing that if you want to.
Did you say as a city of Keene person, I am under a third party contract?
No, you're not. The city of Keene is under a 30-month contract with Standard Power, but that's the city of Keene. The individual ratepayers aren't bound to that contract. So you can just go to our website and sign up for Cheshire Community Power. And
Yeah, explain how we're generating revenues.
okay, all right. The way it's traditionally done with brokers, 25 years ago, when Eversource got broken up, and they were told that, okay, you still have to provide electricity to all of your customers. But we're gonna split the bill up 2 ways, you know, you're still gonna get paid for your poles and your maintenance and all of that other stuff, because it's a transportation cost. But you're gonna have to go out in the market twice a year and buy enough electricity for your customers, and it'll pass through your billing process, but you can't make a profit on it. But they had to do it two times a year. The worst times of the year, you can buy electric power in January and in August. Was the worst possible times. That opened the door for a lot of third-party brokers to go out there and just sort of pass through, you know, sign up towns and whoever, companies mostly at that time. And just send your data to whatever the utility is and take a cut, take a profit. And that profit is typically a nickel or so, for doing essentially nothing. You know, because Eversource was still doing all the work anyway. So instead of having a profit, the coalition has, instead of taking that nickel, we take about 3 cents to operate, you know, we have 4 employees, you gotta, you know, you have to keep the doors open, keep electricity on, that kind of thing. But also involved in that is what we call the reserve account, that you should bring in a little money every month from all of the ratepayers, there's no public money involved, whatever. And it builds up a fund so that we can hedge prices in the market. Say if there was a world war or something like that, and the price went kahoot, we could take a little bit of that money and knock off the tops of the peaks, smooth it out, you know. And that's essentially what allowed us to come in so low this time, is because we started really building up a good head of steam.
Mhm.
And that's the initial reserve account, you know, for operations. And that's essentially how we're always going to be able to.
Because it just
Up
keeps
it.
generating.
Yeah, we're only gonna bring it up, we're at $3 million now, we're only gonna bring it up to like $10 million.
The reserve.
Yeah, and then because it's sort of like our reserve,
Mhm.
our fund balance.
Right, you're gonna keep it at a place where you think
Yeah, it's something safe, you know,
Yeah.
so in case the shit hits the fan, you wanna have enough money to take care of, you know, anything like that.
Mhm.
After we get that, you know, that reserve up to a certain level, any more money is gonna start going to the member towns or the county, whatever,
Mhm.
into their own reserve account.
Kind of a rebate.
Well, it's not really a rebate. What it is, it's a capital fund that we can start using to build a solar array. Or use,
Oh, okay, it goes back to the members.
yeah, it goes back to the members so that we can, you know,
we can continue to do
Yeah.
the green projects that we're
Yeah, yeah.
trying to do, yeah.
And so that's sort of like an extra benefit. We're not gonna reach that point for another couple of years probably. But that's, you know, going down the road, that's another one of those benefits that is gonna make these third-party brokers passe. I mean, they're gonna be out of business because they're just not gonna be able to compete with anybody.
Unless they change the way they're doing business.
They won't be able to because they're in it for profit.
Right.
And see, and the reason that New Hampshire has the highest electrical rates in the country is because they've been using that model. But the reason they're more expensive, they've just been doing it more aggressively. They're just greedier. It really has nothing to do with the cost of the generation of the electricity.
Mhm.
Because our rate, even though it's lower to 8.1 cents, Eversource isn't making any less money. Power plants aren't making any less money. It's the middleman that the brokers aren't taking that big piece. And families are able, you know, in this case here, on 650 kilowatt hours per month average, you know, you're gonna be saving another $25.
And so what about those of us that live out in the woods, Walpole, that have
Well,
local
Walpole,
utilities?
Walpole is in Cheshire Community Power. So unless you have, phase 2, solar, which means if you're used to getting the check back from the,
I know,
okay,
I just feed it in.
you just feed it in, you use more than you provide.
I do.
Right, so you're in that rate already.
So when my next bill comes in, what,
Yeah, it should be, you should be paying, okay, on the 2 lines. The Eversource line is still gonna stay the I mean, the Liberty line is still gonna stay the same.
It's gonna have the delivery.
Yeah, the delivery charge.
Yeah.
But
the actual
the
cost?
actual cost of electricity, it should say Walpole Power, Walpole Community Power line. Right now,
And Walpole went in
they went in originally,
with an opt-out?
yeah,
If I
yeah.
didn't do anything, I'm in.
right.
And I thought that there was some issue with people that had solar, that they didn't know how to
Yeah,
calculate it or something.
Eversource hasn't found a way to provide
your data to us so that we can calculate how much money you've earned.
I see.
But that's only for the phase two. How old is your, system?
8 years.
8 years ago? Yeah, you should already be enrolled. If you're not,
My
Paul,
electric bill, does nothing go up.
Paul Looney.
Who?
Paul Looney, he's your, town,
Oh,
energy guy. All right. Yeah. So, yeah.
You know the guy that used to work here?
Yeah, that guy.
He's called me a few times this week.
short, bald guy.
I'm surprised he's not on here.
Oh, that's not his phone?
No,
That's the jail.
yeah. All right, we're gonna, thank you, Terry.
Yeah,
for
that's
that.
great news. Thank you. That's a lot of work.
It really is.
Well, let's hope it really catches on. I mean, now.
It is already.
I
We've
think-
got,
I think
we've got
it's-
55 towns already joined in 2 counties now. And every town except for Grange and, Richmond have joined some sort of community college program or are looking into community college.
And Ridge has voted not to, or they just.
Well, they're just not entertaining it.
But we're gonna
You don't
send
have
them,
to
we're gonna
vote.
send them the information
Okay.
and let them make their own decisions. I'm gonna keep on moving on, just remind
You might think that Hunt would be pushing them to do that because John Hunt was one of the biggest.
Yeah.
uh, uh, Voices in terms of cost of power in New Hampshire with economic development and everything.
Mhm.
He always was talking about lamenting how expensive electricity is here. That's why nobody comes here to visit.
And he's probably an investor in the current system.
What do you suggest?
I'm gonna keep, we're gonna keep on moving on here. Monday, 9 to 11:45, we have and that's the 8th, from 9 to 11:45, as I said. In the main hall, the delegations executive committee will meet and start budget processes.
So will we also Zoom and record that?
Why not?
They put up in Concord.
Yep. So registry of deeds, conservation, UNH cooperative extension grants, county received, system of care, recovery coach, EMS, and so other
Yeah.
parts of grants, I'm saying, right?
Are you talking about for Monday?
Management, yeah.
EMS?
Grants
is still on
management, sorry, grants management. It's switched together, so it reads differently here. Grants management, the delegation, restorative justice, finance, treasury, personnel administration, and behavioral health court and drug court. Those are the ones that are gonna
that?
be,
Did you read EMS off on that list?
He did, it sounded like a mistake.
Oh, EMS education grant, got it,
Yeah.
okay.
yeah,
Yeah, it's part of the grant.
Yeah.
Okay, I was like.
so that's on Monday, if you're gonna be here, or if you're gonna zoom in.
That's a thought. I mean, normally. Sometimes it's helpful to be in the room, but they do their own thing, so I'm not quite sure how useful it is.
I don't disagree. Yeah, I don't know if you've received this or not, but, the inauguration, the mayor's inauguration was postponed because both Jay, Cheryl and others, came down with COVID.
Should have gotten your invitation yesterday.
Yeah, you didn't, because some reason it got pushed back, so I got it, and so
Like
I'm,
electronic invitation,
yeah,
not a printed, embossed, gold.
No. especially now that they.
They don't tell a big part.
So
And no free parking?
this Thursday from, is that tomorrow?
Yes.
Today, Wednesday, yeah. Tomorrow, from 6 to 7, the mayor and council inauguration. Everybody be sworn in. There'll be a very light business agenda, and then from 7 to 7:45, city council regular meeting, and then from 7 to 9, it says light reception. In my experience, it's the inauguration, swearing in, it's the speech, any business that they have to take care of, they will take care of.
They have to do the council rules of order.
Right, it's very procedural. And then there's a social gathering afterwards at Lucas in the bar room, not the new section that they built on.
Have you seen that?
You know where the marketplace used to be?
Yeah, they punched a hole in there, finally?
It's the old, Oaken Grade.
Oh, Keen.
So they revamped it a little bit,
Yeah.
but they've utilized the
Pronounce that
bar.
correct.
What?
You pronounce that correct.
Oaken Grade?
Oh, Keen.
Oh, oh,
Never mind.
T-H-O.
You're supposed to chuckle.
I said we can't say, we said we can't say that word on.
So, I know I'll be attending. If others want to, that's great, but I'll be there.
That's a Thursday.
This tomorrow, yeah.
I think I'm going to, and I'll respond if I get home.
Okay. So I'm gonna keep on moving on. I already told you about the January 8th, 5 PM Whitcomb Hall. I'll be with the Swansea Economic Development Committee, Advisory Committee, I should say. Also want to make you aware that the
Is Luca going to manage it?
I guess he
From the
could.
business development, chamber.
I guess he could, and if on that part, you know, I could also invite Cody Morrison to come with me too, to see that, you know, because, and if really, I mean, my whole scope has been that from the get-go, we are looking at, from the county's perspective, not building within, but to work with those in the community. We've got policy and process and procedures through Southwest Regional Planning Commissioning. We've got the marketing through the chamber, then we get the real guts of it going out and doing it through Medic, and it's a partnership that we all acknowledge.
Okay.
So, and it shows by the financial support we've given each one of those throughout, so. But so yeah, I want to make you aware that though officially, my understanding from Chief Olson is on the 5th of January is when we officially are in place to take on the calls for to support the city of Keene and its 5 contracted towns. It's not to say that we haven't, as we've, prior to even doing these calls, that over the last month and a half, we've made the city of Keene, and the chief of the Keene Fire Department aware that we would back them up if they asked, as we have since day one. And we have responded to 2 calls in the city of Keene that I'm aware of, I've been made aware of by Chief Olson, and just want to make you aware of that, so that we're already in that process. Even though Dan Mitchell did send me a email saying, Chris, I got a caller said that you guys stepped out, decided to drop the contract with the city of Keene, and that, yeah, Rescue Inc. is coming in and is doing it for free, and I'm like, nope, not real, it's like, yeah, and I'm like, and he's like, I know the answer to this, but I have to ask what I have to ask, and I said, no, it's all complete, you know, sadly, we continue to have misinformation put out there by whoever, and it's just.
Did he say where it came?
No. He said just a listener. So I just wanted to make you, that's my understanding is official, but we are part of the city already because we're coming in and we're working with them in a partnership, where they've asked us to do so.
How are we doing with our EMS website and information stuff?
I got delayed by a little bit from Paragon.
Do you want to come over here just in case they can't hear you?
Yeah, of course.
I mean, it just seems like it's taken over a year or 2 to actually get that up and running.
Yeah, it's taken very long, and there's been delay after delay that I've been watching happen from them.
Well, why is that? Because otherwise they seem to perform.
It's interesting because I texted you or called you last night and said, remind me tomorrow that we want to talk about the website.
Yeah.
Because I don't know why that is. I don't, we're gonna find out now. It's now that, I mean, we have an opportunity to take a look at it and through Davis's eyes, and let's see if what we need to do to, even on our side, there's still stuff that, I mean.
I know we've also not, I mean, I'm not blaming it all on Paragon.
No,
I know we've had we just haven't been able to get to it in a lot of ways, a lot of time. For a lot of reasons.
and so I'm, at this
We paid a
point,
lot of money to them.
but here's the thing, we took an antiquated, website, we brought it to this level. But now I think we have to look at it again, and I know that Dan reached out to me, has talked to me a few times, that he's not happy either with our website. There's an EMS website, so it may be that we have to take a look at how do we take the next steps to get to where we need to be.
We stand with WordPress.
Yeah, we still have WordPress and there's been some updates, but some of the tools are still lacking on there. And
Well, it's very clunky.
it is.
You gotta be a brain surgeon to understand how to.
And it's never.
I just searched through that website for hours, just learning more, just so I can
Yeah,
know everything I can know about
I
it.
think it's open source.
It is, yeah.
I wanna make it, our whole goal, and I think we accomplished it initially, was to make it easier than what it was. But it's still not where it needs to be, and so I literally last night said, we need to remind me, we need to talk today about the website, because I just need to start getting a handle on what we need to do to take next steps to be where we need to be, and then you bring up the EMS and that whole thing too. I just think we're missing some opportunities to tell our story if we, and if we don't get it to the level we need to.
I just don't. I don't get it, but
Yeah,
EMS should be up by next week, but it should have been up by, I think, around middle of December, so I don't really know. Chad Butler has done a great job at supplying all the information they've asked for the website, just to check them out there, supplying a lot of data for them, so it's gonna look good when it's there. From what we've
But
supplied.
even
at
once
least.
you go on our website, it's kind of like, that whole upper section that
Yeah.
just shows a big picture of certain, that's where you should just, it's like even community power. You have to go search through events and happenings, and all you see is minutes to some meeting or
Exactly.
11/22.
That ought to be up
It
to
just like,
departments.
yeah,
It
it's
should-
like our,
EMS should be under departments.
Or miss,
Yeah.
like,
Yeah.
resources or additional.
and just remember, Paragon did not develop this website,
Oh, yeah.
Millennium did, over in Manchester. And so, it's just that, I mean, it's time again, I mean, the city of Keene just went through their whole rebranding and rechanging of everything. And others I see around,
And it's
counties are doing it
it's
too.
incredibly bad.
Yeah.
oh, really?
Yeah, you-
My thing is I wanna be,
It's supposed to be interactive. You go in there to search for something, say if you can't find the energy page, you type in, energy. All it does is bring you to the minutes where they talk about anything that mentions energy. It doesn't bring you to their page. You can't find anything.
yeah. Well, it just that, I just think on our side, we just need to take a look at how to move forward. And that's what I was gonna tell you is go in with, it's an opportunity with fresh eyes to go in and take a look at certain things. And this is one of them, our website, and see if there's things that we can change to make it stronger.
Is there any benefit to having them on an agenda and describe to us what their plan is and what the architecture looks like? I mean, I feel like it's been happening kind of behind the scenes.
Yeah.
Putting it on an agenda might give it legs.
I think, yes, what I wanted to do is. What I wanted to do is have David set up a time where we can meet with Zach, Luce and others over at Paragon. And then take that step of them coming here saying, this is where we're at, this is where we want to go. And I don't know, are you guys the right guys to make that happen? And then bring it to the commissioners and others.
Chris, we've been dancing with it for 2.5 years,
Yeah,
or 3 years.
yeah,
I mean, but I guess my thing is, and maybe it's just an information thing, I didn't even know what we're headed towards, I mean, I would think that we've had a conversation about, here's what it's gonna look like, here's how it's gonna work, here's how we're gonna grab people in the first, like, 11 seconds,
here's what, you know, a sense of where we're at now and where we're gonna be, and then how we're gonna get there. I just don't know that.
Yeah.
Obviously, somebody does, but I don't.
Yeah.
I don't know.
And I think that's what we want to get a handle on. So, yeah, that's what we're gonna work on. And I'll get back to you once we've had that opportunity to talk with Zach too. Okay? I'm gonna keep on moving here. Want to make you aware of, as you remember, our paramedic intercept hit a deer and the car was totaled.
Really?
Mhm.
Oh, I didn't know.
Yeah, yeah.
Oh, wait,
We bring the deer
Yeah.
over to Maplewood.
The deer actually was picked up 10 minutes after the accident occurred. Somebody saw the deer on the side of the road, saw the damage, realized it was a fresh, pulled over his truck, picked the deer up, put it in the back and drove away.
Cause that's our deer.
I know, it's not, actually, it's not the way it's supposed to be.
I know.
Yeah, it is.
No, it isn't.
I hit a moose once and they said, you wanna bring it home with you, right?
Who said?
St. Louis.
Yes, that's different. But it didn't happen here.
No, this was just a guy driving in a truck,
Yeah, yeah.
pulled over the side of the road, saw the
no,
deer,
yeah,
saw that it was fresh kill.
Yeah,
Saw that it was, and just picked it up through the back of his truck and said, honey, I don't need to go hunting.
Oh, whoever hits it, well, you know.
So I want to make you aware that, you know, we've been in conversation with Swansea had some vehicles that are in good shape. And that, SUV
Yeah,
and,
That's Michael's old vehicle.
no,
Oh.
it's not. It's
Well,
actually,
I hope we
it's through
can
the
say-
fire department. And it's, Primex has given us an amount that they'll pay us. And it was probably gonna be about 10 grand that we're
But
gonna
is
pay.
it, does it include the improvements and the equipment, that sort of thing? Because, you know, that cage in the back was almost $10,000.
Yeah.
The aluminum,
Well, we're hoping that we can take any and all that
we'll
stuff.
get
That
a
wasn't
similar
damaged.
vehicle. We got another Explorer.
No, it's a Yukon type vehicle, but yeah. Which they feel is the most
So
appropriate.
this was an interesting question. The question really from a structural point of view is, should we replace the intercept vehicle? That's $100,000 a year expenditure that we don't get any money for, basically. When we could put a medic in an ambulance.
I think until we can have a chief in place and have them have some time underhand that, you know, understanding what we're trying to do here. And we do need that in the meantime, that,
Well, we need it and we have it in an ambulance. But we'll see.
yeah. So nothing's been decided yet, but I'm just telling you that that's where things stand currently.
When did we hit the deer? I guess I didn't realize the.
I was in Maryland at the time.
Thanksgiving.
Yeah, it was probably right, yeah, it was before Thanksgiving.
I think you might have missed one meeting. I think it might have been meeting where we discussed the deer.
Yeah,
Ah.
just a reminder that on Friday we have the chief interviews.
Right.
Which actually the process starts actually tomorrow. They're coming in and they're doing the writing portion of the interviews tomorrow. And on Friday, we've got a panel here and a panel down at the EMS building. You're part of the panel here. And it starts at, they're asking you to be here at 8:30. You should have received an email from Don Bliss.
I don't
So I'll
remember
make sure.
Yeah.
Remember that.
Huh,
When would that have?
It came out, well,
Oh, yeah, chief interview. I have 9
yeah,
o'clock. It's
on
8 o'clock.
December 20th.
8:30, nine o'clock is when things start, but we like to have people here by 8:30. We'll have some light refreshments / pastries.
The last thing I saw was 12/21, all panelists confirmed.
honestly, the one I got was only to meet Kim, so I don't know, I can't speak for the one.
Tom will be here today. So
Yeah.
I'm checking with him about that.
We'll make sure that you get it,
So,
but I'm telling,
were the resumes attached?
not yet, they're supposed to go out today.
Okay.
So 8:30 until when?
Till done.
8:30 until probably
Is what you're
noon-ish
saying.
There's
at
three of
this
them,
point.
about an hour apiece.
Yeah, we have 2 interviews.
Two interviews.
2 candidates. And they're strong candidates. One's, regional and one is, from outside the state.
Was there originally more?
No. I mean, there were some other there was 10 candidates total. They whittled it down, and so. That's where we're at. And so there's 2 sets of interviews. It's the 2 interviews. There's one gonna be happening down at the EMS with staff, and Don Bliss is gonna be running that. And then Brian Dugan's gonna be up here with us running the Duggan. All right.
So it's the same 2 people being interviewed,
One down here, one up there, then they switch.
okay.
And then after that, my understanding is that, the group down there will come up here. We'll all have lunch with the candidates, then, the candidates leave. The group from here then makes their recommendation, and then they leave, and then we discuss and make the final decision from there.
Can you, so we're having lunch with both of the candidates at the same time?
That's what, yep.
Oh.
Just put them in an environment, where they can have another opportunity, because where we're seeing them is right before us. And they're answering this. And then, but to have them both in the room, being social, being active.
See if they play well.
Different.
Right,
We actually did a meet and greet like that, that I attended when they hired Elizabeth. The 2 finalists were in the room, and
Yeah.
staff and everybody got to beat them up and shake hands.
so we're, so it's gonna be, I think it'll be a good process. We're well represented across the boards, and so I think we should be good.
That's Friday the 5th, the day after tomorrow. Okay.
Make you aware the mileage, bed mileage rates have changed from 65.5 to 67 cents. And last but not least, one of the things that,
I can't remember the last time I put in a mileage anything.
me either,
Now,
I haven't done it in 2 or 3 years, I don't think.
They did it this morning.
Did you?
Salary should take care of all of that.
Yeah. Well, you just said the resumes. So,
That's what that.
so I don't know if you just received that or not. Find one last thing, and then we're done. There. So yesterday, received an email from Lori Kaiser from Keene Sentinel. And she wanted to, a while ago, there was and it's one of the reasons this morning I brought this up without telling you. Because I wanted you, I didn't want to react to an email I didn't want you to react to an email you received. I wanted you to just honestly say if we should, start, because we've had this conversation before, as I said, about, recording our meetings and all that jazz. And so I received an email, Jack, actually, they tried to send it to Jack, and for some reason it wasn't going through, so we did send it on to Jack, and Jack and I had a conversation prior to this. But the editorial board, meeting today, a question, surfaced on, where city councilor had brought up, charge that the county commissioners lack transparency. And, noted that in the November letter that the meetings are held at 8:30 AM, which goes back years and years and years. I mean, it's just been, that's what we've done. And after doing some research countywide, you wanna come over and it's just your information?
So
It seems to me we actually used to change the time.
Not anything after hours, but we had times when we started at 9. I mean, really, it's been an adjustment. But it'd be interesting to see what he has to say. I mean, I have some understanding. I mean, a lot of department heads that, I mean, a lot of what you do are based on the operations of what are
Yeah,
going
yeah, I
on.
know, I know.
You have, I mean, even though obviously it's here for the public, but you gotta have some consideration for the fact that you gotta bring department heads and
Yeah.
stuff in to be making decisions and.
Let's see what Dave has
No, you're
to say.
hitting it right on the
Oh,
head. I
okay.
think there's two, I did all the municipalities in Cheshire County and then also all the counties in the state. And most of the municipalities do work after hours, between 4:30 to 7 is the average with inconsistent meeting times throughout the month, but counties, it's very clear that besides Belknap, which meets Mondays at 5:15, Carroll's Thursdays at 9 AM. Coas is Wednesdays at 9 AM, Grafton is Tuesdays at 9 AM, Merrimack is Mondays at 10 AM, Rockingham is Thursdays at 8:30 AM, Stratford is Thursdays at 9 AM, and Sullivan is Mondays at 3 PM. Most of those are actually every other week, so we are very in line with every other county in the state meeting in the morning.
So, but
Because we have so many staff.
every other week too. We meet every week.
And many of them don't support Zoom anymore, but we do.
They don't want to, they support.
You know,
Some of them don't, they ask for just.
So they only did
registration
it
only.
with COVID.
Or some of them don't do Zoom, but they do record it.
And I think maybe 25 years ago, one of the meetings that we had was in the evening. But I can't
Then when you
remember.
moved, you went to a different
Well,
town?
we've
That
rotated.
did not fall in space.
We've rotated. We actually, in order to be more transparent and increase our reach, we actually went town to town. We picked towns like every third meeting or every other meeting was in a different community. And then the boards there were hostess. Because we thought, well, let's go to the people, right? But the people still didn't really show up. And so it didn't really change anything, so that was. And then I seem to remember that there was at least one meeting a month, I can't remember what the interval was, where we meet later in the day. Do you remember that?
I don't, and it's very possible if you're talking 25 years ago, I wouldn't have been in this position where I would have been attending commissioners meetings regularly.
Yeah.
I
And
mean,
I
maybe
would,
there was one per month that was,
yeah,
But I-
Well, let's
remember.
talk technically though, you know. They say that we're not transparent. Now that has a legal type of a definition. If we're following the rules set by the legislature,
yeah.
then they have defined what transparent is.
I'll say we are more transparent than any public entity
So,
ever.
this is just becoming a trend for people to come out of nowhere
Right.
and to, have an opinion.
Well,
And then expect everybody else to say, well, yeah, your opinion is absolutely right,
You know,
when we're following the law.
and here's something I thought about last night. How many county administrators had a radio show on a Saturday for 7 years of the 9 years I've been here? First on Saturdays for 3 hours every Saturday for 7 years. Where anybody could call in, that we talked about everything, but a lot of it was about county, that you were on that show, I don't know how many times. Terry, you were on the show a few times, probably more as a city councilor, but I mean,
yeah, no, that's a good point.
and how many towns have we visited? How many Zooms have we had with towns? How many letters have we sent out about all kinds of different things, especially during when COVID started moving on? I mean, it's just easy to throw out word
It's not about,
verbiage.
it's not about us, it's about him. He just wants to be decided. That's what it's all about.
It's just
Nothing to do-
disappointing because I
Nothing to
think
do with us.
from what you just said to me, one, we meet every week. Two, yeah, today, anybody can go online and moving forward, anybody can go online and hear it and hear the thought And, I'm glad that today went as well as it went, as in that the discussion is still there. Because if we lose the discussion and we turn into what I see in other municipalities, where it becomes very rigid, things like this, we lose I think people connect to the conversation we have today. We're actually putting a lot of thought into it.
Our meetings are more substantive than any community I've ever either run or participated in.
City council, even a city councilor can only speak 3 times, 2 minutes
On the same subject.
on the same subject, yeah.
Yeah.
And that's just
Public
silly.
comment is.
That's just silly.
Well, it is, and then you, because of 91A, you can't talk about it with other councilors beforehand.
But I'm
So
not
you're
aware,
expected
I'm not
to
aware
actually-
anywhere on the agenda where the public can talk.
Only a committee.
Right. Like at our meetings, we have public comment at the beginning, and we have public comment probably throughout if the chair allows it.
We're not gonna cut them off at 3 minutes, even though it states that it's for 3 minutes, we'll allow them to.
I've
say their
been,
piece.
up where I'm working now, we have 20 to 30 people that attend the select board meetings. And there's a lot of interaction. On the one hand, everybody's got an opinion, because everybody's a road expert and everybody's this. But the fact is, the board welcomes really anybody's comments for any purpose at any time throughout the entire meeting. So they can have an opinion on anything. And it's, in a way, it's kind of refreshing.
This is the town.
Yeah.
Yeah, and here's,
And we did the same thing in the previous town.
and here's the problem, at 8:30. That's how it's always been. And I tell you, I was 10 years on the city council and 10 years on the school board and now here. And I watched my wife with the school board that she's been having to go to meetings for 28 years. To school board meetings. And they all hate the fact that they work all day. Then they gotta go someplace and have dinner or bring dinner. And then they gotta come in and sit there, and some of it, they're not even on the agenda, but they have to be there because that's the process.
Okay, so that actually, for Steph, is a good point. That cuts into their productivity, because if they go to a meeting, sit there for 3 hours,
Yeah,
whether they say anything or not, most of the time they're not saying anything. They get 3 hours off the next day, that they can't be doing their jobs.
Oh, that's interesting. Yeah.
oh, I didn't know that.
Yeah, that's-
Because it doesn't happen in my wife's place, so she goes in the next day, she doesn't get.
No, you get comp time.
Yeah.
You get comp time.
No. Well, in some places they do that, but here's my thing is that we have them in-house, it's like Doug and Kim are here, but they're able to work at the same time. And I've had Bruce Harrison come down here and present, and then he turns around and goes right back up, because he's working, so it's only taking, an hour out of his day for something he needs to come down and report out to.
We used to, again, decades ago, we used to have all department heads every meeting all the time.
Yeah.
And then we realized, that's a waste of productivity for a lot of these, because they don't have something active on the agenda.
Yeah.
Don't,
Send them a memo.
yeah, they, got 20 minutes down here, 20 minutes back. I mean, it didn't make any sense. So I'm not unhappy. And the other fiction is that the entire world works 8 to 4. And of course, a third of the world works evenings and another third works nights.
Right.
And so really, 2/3 of the population potentially have a better opportunity to come here in the morning than they do at night, because the world works 24 hours a day.
Yeah.
We have more facilities than anybody
Yeah,
that are 24/7. And, so it's a fiction. It's, to me, it's empty. I don't buy it.
They just want,
One city councilor who.
Yeah, Madison,
Who,
he
but-
wants to beat us up. That's
Who, by the way, has never even been to a meeting, so he doesn't know about what we do anyway.
And by the way, Ed's been a city councilor for a couple of years now, he hasn't done a goddamn thing.
Well, the other thing.
it's neither here nor there, I mean,
So I don't
to
have-
me, it's not about that, it's about the issue of transparency, I find that we're, if, it's. Again, I've had a reporter say to us, I can't believe you guys turn around so fast to give us the information that we're asking.
Yeah.
I mean, it's.
I used
we-
to, if I talk about transparency, there was a few years in a row for, maybe it was around the jail debate,
Mhm.
which lasted 10 years. I would invite Keithson, the reporter, just to come over and look through the files.
Yeah,
And they did that like once or twice.
Well, we've
Just-
invited,
the
we've
question is, what-
anybody to anytime come and talk to us and ask us questions that they may have pertaining to anything.
Right.
You know,
Right.
it is what it is, but,
Most
and
people-
again, I have a show that anybody could call into and ask that question straight up from anywhere. And we had some of those people do that for 7 of the 9 years I've been here.
Yeah.
It's been that way, so.
So I reject the conversation that we're not transparent. Because
Yeah.
we are more transparent than any government.
And 8:30 seems consistent with what other counties are doing around the state, whether that's right or wrong.
Well, and you know, county government, just by virtue of where we get our funding, who appropriates us and who gives us the
Mhm.
majority of votes to carry this out, are the state representatives. And guess what? Their meetings are all during the daytime. Their committees are all during the daytime.
When do they start?
Yeah.
Oh, 9 o'clock in the morning. I don't
Yeah, I mean,
know.
Yeah, they close at 5.
Right, I mean, I have to leave here, I have to drive to Concord to testify if I'm gonna testify for something
Yeah.
during the day.
And you know something? There's a ton of people that find, if there's interested, they show up at committee meetings. And so we're more tied to the state representatives than we are to the local folks. And so there's that pattern. And when we have budget meetings, it's because state reps don't have a session on Monday. And that's when they're available to do budget reviews and appropriate our budget and our stuff. So there's a logic to the pattern that we've had for 200 years. It's a structural sort of thing. Does that mean we could have a nighttime meeting, 5 o'clock or 6 o'clock meeting?
Maybe once a month.
Wouldn't bother me, but I'm not gonna be dragging a lot of 24/7 fund managers in for an evening meeting unless there's a reason for it.
Right. So it goes on, so the 8:30 time, I don't see that, I just see that's a reality that where we've been, I'm gonna keep moving on. She asked if the meetings are recorded, and as of today, they will be moving forward. Up to that point, we didn't really see the purpose.
And I think the minutes are long.
Yeah,
I think the
and
minutes are perfectly fine.
Are you
And-
comfortable
she
with
did
them?
quote, see that they are on Zoom, and that means it is interactive.
Very
Um,
comfortable. Very, very good.
And,
Minutes from Rod for many years and from you as well.
and that, then also the city councilor says that, significant delay in posting meetings, which is just false,
Not true.
not true.
Well, and the fact is, there's no law that requires any posting on any media. They just have to be physically present for inspection. It's popular to post them, but it's not the law, and we do it.
Yeah,
I will
So-
just say that while I was doing my research last night, so I'm not gonna call them any amount by specifics, but there were many municipalities that were very behind on their minutes.
And it's,
Extremely, so.
yeah, because it's a process. It takes labor hours. And I know in the town that I'm at now, there's just me 2 days a week in the office. There's no administrative assistant. And I have to.
You stay late?
I have to. What's that?
You stay late?
I worked 12.75 hours yesterday. Yeah, so, but we're holding it together. But I don't care about that. It's not a requirement.
It's
not a law.
noise.
It's a mere convenience.
And
And that's just the way it is.
and it does say that it also lacks detail, which I'm not finding that any of us believe is true.
Me and Chris spoke about this, but our minutes are very in line with every other county in the state and New England.
Well, and I
It's
think
just
they're very.
done differently than cities.
What we're
Is what
talking
it
about.
is.
Yeah,
And you wouldn't know that the only way that you would know that they don't have enough detail, if you actually came to a meeting and they looked at the minutes and you could compare the two. And I think if you did both of those, you'd be saying, oh, I know what happened.
Yeah.
So it's just empty noise for me.
Yeah.
I don't mind recording, so what?
Yeah. I'm glad, one, because I think we'll be able to tell our story, but two, it hasn't affected how we go about our business, and that's the key ingredient here. This is the pleasure of the job, and for me, is that we're able to sit here and have a conversation instead of
You want to invite her over,
right this second.
wherever this was, maybe private.
I can reach out to her and see if she's available.
I mean, what's your?
Well, I mean, I can call, and we can write something up, or, and we can also, we can also time identify
Yeah, I can go back
this
to.
conversation for her too. But I can also call her this second and say,
Well, it is already 10 after 12, so.
all right,
I mean, it wouldn't bother us.
You can executive session and non-meeting as well, you said.
yeah,
Oh,
so,
right, right.
yeah, so let's,
That stuff.
so I just want to make you
We'll
aware of
get
that, but I did it on, I kept this for this end of it on purpose, because I wanted you guys to base your decision on what you thought was right, and Terry, you came right out with, I don't care. I mean, yeah, fine, you know, and that's,
The guy has.
I don't want
guy has
to
a
reactionary,
agenda.
I never want to react to anybody's, chart. I want to do, because I just find it baseless. I find us to be as transparent, more so than anything I've ever been associated with. So it's just frustrating. And again, that individual or any city councilor, we presented before the city council on 2 occasions around certain issues. And we would go to the city council anytime they asked us to talk about anything that, and when we're there, we've always said, do you have any questions? And I think there was only one person, and that was the mayor, former mayor at the time, that asked us one question. And that was it. And we got up and we left. That's it. That's all that's ever happened. So it's a little frustrating on that end. But it's also the same council that said that we were running a Ponzi scheme over here too, which I have no understanding what that
That's a
meant.
Political agenda and.
Yeah, I don't understand what that means.
I don't even know
It's
what
neither
this
here,
thing
it's just,
Is even paying attention to it.
yeah, so that's all. That's all I have. I'm gonna keep on going.
Okay. Yeah, I don't want to keep everybody, we've got another.
Yeah.
Couple of them.
Yeah, county let's see, old business, is there any old business, any new business?
Oh,
Seeing none,
what is this legislative conference that I saw come out that?
it's something new this year that, the Tupon Group is really heading up, and it is, an opportunity to really become that much more, interactive with our state legislators
Going
as
through the bills.
going through certain bills, having certain speakers there to discuss certain things with
So
legislators.
it's actually an event you go to? and
Yeah.
Like a mini conference?
Yeah, it's like a mini conference from like, what was it, 11 to 3 or something like that. And they have certain speakers come in and speak, and people can ask questions, and we'll be there, and you all would be there to,
New Hampshire
You know,
Municipal Association does.
yeah.
as well.
It's just over the last 3 years, one of the goals of the New Hampshire Association of Counties is to become more active on the state level to protect ourselves, and doing so, protecting the citizens that have to put the bill when the unfunded mandates come down from the state of New Hampshire, and having a stronger voice about this. We've done a lot of that building. This is the next step.
Okay.
So,
Yeah, it's hard to combat a bill after it's already passed.
yeah. So, the consent agenda, vote to accept the weekly manifest and minutes of December 20th, 2023.
So moved.
Second.
Again, Commissioner Wasback, Commissioner England,
Aye.
Commissioner Clark.
I noticed we had several transmissions to the unclaimed property or abandoned property.
That happens every year this time of
Yeah.
year.
It's always curious to kind of see it, literally $1.46,
Yeah.
$2, $24. Are these mostly nursing home residents or inmates?
I'd have to look at the backup. Some of them are inmate accounts, but some are payroll checks that just don't even get.
Really? They don't
Yeah,
get
we have
cashed
to
their
do
check?
that. Payroll, we have to do annually. Accounts payable, we have to do every 5 years.
Yeah, I saw one of them was from like 2018 or
I
2017.
remember about 20 years ago, I was going through my wallet and I found a three or 4 month old paycheck. Couldn't believe that I went through a whole week without cashing my check.
Did
Yeah, that
you
was-
go back and make good on
Huh?
it? Did you go back and make good on
Did I go back and what?
it? And make them make
Did you
good
cash
on it?
I cashed it.
Oh.
I cashed it.
And we have some people
Brought
that,
my wife out to dinner too, I think.
Wow. I actually did a search down in Massachusetts on unclaimed property, and I actually had. My name was actually in there for some money, but it was back when I was practicing law down there. there was a kid who was a minor. And he got a settlement, which I have no idea where he is these days. But moving on.
All right, at this point, we're going to enter into non-public session. Turning to RSA 91A3, matters which this public would likely affect adversely the reputation of any person other than a member of this board unless such person requests an open meeting.
So we have to make stop the recording.
We would, yeah, but we don't stop it until I go, you moved it, Commissioner Wasback.
Aye.
Commissioner England.
Aye.
Commissioner Clark, aye, so we go into non-public.
And what time?
Motion to come out of non-public.
So it is 12:45, and I'll accept a motion to come out of non-public session.
So moved. Second.
Commissioner Wasmac,
Aye.
Commissioner England,
Aye.
Commissioner Clark.
Yes.
So, this, non-public, under 91A was in consideration of security-related issues bearing on the immediate safety and security personnel or inmates of the county correctional facilities by county correctional superintendents or their designees. As a result of deliberations in non-public session, no votes were taken and no decisions made. So now we're back in public session. This is
And
another non-public.
this would be a non-meeting.
Non-meeting.
Reference, and we'd be going into a non-meeting for union matters.
And then following so we might as well, if we're going into a non-meeting, we might as well adjourn, but we don't have to come back in from a non-meeting. Right.
Yes, we've already accepted the minutes.
We'll adjourn.
So you're all set.
Move to adjourn.
Now we'll move to adjourn to enter into a non-meeting at 12:46.
And
to
reference
discuss
to
union
union matter.
negotiations.
Okay,
Okay.
Adjourned at
Commissioner Wasmac.
Aye.
Commissioner England and Commissioner Clark.
Yes.
adjourned at 12:46 PM.
Yeah.
And